time for us versus them.
Panogitsa moru purita nonda kantai mantunat nyagitoru iluga.
GMH Administrator Lillian.
University of Guam Dean of Nursing, Margaret.
There is light at the end of the tunnel.
Help is on the way from a marine medical.
Out in the public, where all are more exposed.
585 have tested positive.
Good morning, Guam!
It's gonna be that kind of morning?
Yeah, sorry guys, we know we're late. I apologize to the people of Guam and to our viewers and our listeners who are waiting for us to come on. But we just got a FOIA response. I actually got it last night, and we were just looking over it, and wow. Just stay tuned, okay? I'll just give you a little hint. It's got a lot to do with catering for the cabinet. 624, it's Guam's favorite, I-94. Thank you so much to our I-94 family for letting us move in here for the Containing COVID Multimedia Broadcast Extravaganza. It's Wednesday, the 13th day of May. We're in P-Core 2. And we'll get into the day's COVID-19 headlines coming up. Of course, there's always a great big show for you guys this morning. We'll be talking with Dr. Tom Shea. Also on the schedule, Superintendent of Department of Education, John Fernandez. Hoping to talk to Ed Byrne from DOA. He made the commitment yesterday. We'll talk to him about COVID differential pay, double pay, checks being cut. There's a lot of checks going out. How's that stimulus? I saw on social media a lot of you guys got your stimulus. I'm so eggu. Also, we get Mary Rhodes from the Guam Hotel and Restaurant Association. Senator Sabina Perez is tracking this pandemic procurement process that is plagued by problems. So we'll talk with her. And also, we'll get Chief Dan Stone of the Guam Fire Department. And you guys, 637-0094. Definitely want to hear from you. At 6:25, let's do it. A first look at COVID-19 headlines here on Containing COVID from the KUAM News team. Sabrina Salas-Matanani, good morning.
Day and good morning, everyone. The latest from the Joint Information Center released just before 8 o'clock last night. A total of 64 individuals were tested Tuesday. 0 tested positive. However, as reported on primetime last night, 1 additional case was confirmed by the Guam Regional Medical City. To date, there are 152 confirmed cases of COVID-19 on Guam, 5 deaths, and 124 recoveries. Some cases that were previously released from isolation have returned to active isolation status after retesting positive for COVID-19 through follow-up testing. To date, no additional cases have been linked to people released from isolation. Another 20,000 economic impact payments were processed by the Department of Revenue and Taxation, bringing the total to 40,000 to date and a total of $75.9 million that will be mailed out. Governor spokesperson Crystal Paco San Augustine confirmed that over 10,000 checks have hit the post office as of Tuesday. We should note that if you owe child support, your EIP check will be garnished as required by the CARES Act. Payments will be based on validly filed and processed 2019 Guam individual income tax returns, and if an individual has not filed a 2019 Guam individual income tax return, or if filed and Guam DRT has not processed the 2019 tax return at the time of certification of EIP to be paid, but has a validly filed and processed 2018 Guam individual income tax return, then DRT shall determine based on validly filed and processed 2018 Guam individual income tax returns. Residents of Guam should not use their non-filer portal on the IRS website. All Guam residents are required to file with the Guam Department of Revenue and Taxation. You can find Rev and Taxes frequently asked questions on the Guam EIP program on the COVID-19 section of their website at www.guamtax.com. If you have any questions, you can call their call center at 635-1840-4142 or 57 or 635-7603 through 6. Meanwhile, this Friday is the deadline to apply for the governor's local disaster aid program on Public Health's website. In the CNMI, they announced that its first distribution of 27,020 stimulus checks, totaling to about 42.7 million. They have printed 22,306 checks to be mailed, with 813 to Rhoda, 715 to Tinian, and 20,778 to Saipan. Eligibility was determined based on 2018 or 2019 tax returns, and the first batch included all eligible recipients processed without error as of Tuesday. On the front line, but feeling at the end of the line when it comes to being justly compensated. Here's more, with nurses not getting paid their full compensation.
Roses for Nurses Week. But things aren't rosy when it comes to compensation.
The nurses are so frustrated that some of them are, I'd say, on the verge of tears.
Guam Federation of Teachers Rep. Robert Koss says the union has signed up nurses from all over Gov Guam to join a lawsuit they will file against the governor for failing to pay frontliners what they deserve.
They received base pay. They got their differential pay yesterday. I saw a couple of those checks, $160. That's the difference between staying home with your family and kids or working 8 weeks. $160.
Apparently, it's not just nurses either. Public Health Medical Director Dr. Jana Manglotnya confirms she didn't get paid. Although she wouldn't provide specifics about her situation, she's heard of the payroll plight of her coworkers.
One of the nurses, was saying that she had worked to midnight at the airport, etc., and what she was given, apparently there was no overtime authorized or paid to this particular nurse, and I don't know how many, no idea. They said it's all of them, but I'm not sure. Mm-hmm. And she, I think, received $100 for hazardous duty pay after countless hours and frontline work, and threatened exposure to her family.
Over the last several days, the Department of Administration has been paying out differential pay under the governor's COVID response pay program, where essential employees would receive an additional 10 to 25% extra pay based on their level of exposure. What they won't get paid is double pay, authorized in DOA's rules and regulations when an emergency is declared. According to COS, though, double pay isn't the only pay missing in paychecks.
This administration, they only paid a portion of what the rules require. Where do the public employees fall in the governor's priority?
As of Monday, at least 60 GovGuam frontliners have signed up to join GFT's lawsuit. They will continue to take the names of essential employees willing to join the litigation for another 2 weeks. For more information, call the union at 735-4390. Reporting for Guam's News Network, I'm Sabrina Salas, Matanani. For Guam.
Several nurses held a demonstration in the meantime at the ITC intersection late Tuesday afternoon. They were holding posters, signs demanding they get paid what they deserve. Governor Lulian Guerrero, in the meantime, has issued the following statement on pay status for employees responding to COVID-19. Quote, no amount of pay could equal the service, sacrifice, and hard work of our frontliners. That is why we created COVID differential pay in the first place, and why we have always supported a new wage study for teachers and nurses. Though we will reserve comment on a matter which may be litigated, we are confident our administration has acted in accordance with the laws of Guam and the government's personnel rules. In the weeks to come, we hope that the Guam Federation of Teachers and others will work with us to protect lives and livelihoods in both the public and private sectors, end quote. Well, he's a graduate of the Governors of Guam School, and he's here to give his 2 cents. Former Governor Eddie Calvo taking the floor on containing COVID.
Brought to you by GTA. We start with you.
Former two-term Governor Eddie Calvo telling Containing COVID he got his 8-year degree from Guam Governor's School. Calvo telling KUAM's multimedia show while he didn't go to law school, he doesn't need to be a lawyer to see something's not right with the Leon Guerrero Tenorio administration's emergency procurement handled by Governor's legal counsel, Hai Hyun.
I've never heard of verbal agreement, by the way, as a governor, and I've been 20 years in public office as a senator and a governor. I've never heard of a verbal agreement in any government capacity, which it seems to have occurred in this pandemic. And it seems like the paperwork is catching up after the verbal agreement. That's something. I wonder why DJ Cruz is as quiet as he is right now there, because he sure would have been yelling when if I was governor.
Calvo calling out Adelup Communications Director Janela Carrera for muting the media, saying elected leaders must answer tough questions. He added that Adelup's messaging during this COVID crisis leaves much to be desired. Calvo also called out the governor for her refusal to pay state of emergency double pay to GovGuam first responders.
I don't know how you go around things when it says in the books that you got to pay double pay, and if you called an emergency and then call some folks to come out to work on that, then, if it says in the Department of Administration rules and regs it's double pay, it's double pay. I don't know how you can make an executive order to countermand it.
Although he gave props to Democrat Senator Therese Terlahi asking Adelup tough questions and made a shout-out to the Republican minority, Calvo also called out the legislative supermajority for letting the governor slide on many questionable issues. He also said the public auditor and the attorney general have been as quiet as church mouses when it comes to being independent and holding this administration accountable.
Man, they're both quiet. They're both quiet. Where's the attorney general? Where's the public auditor? Levin, BJ, come on, boys, get up there and start looking and doing your jobs.
For Guam's News Network, Chris Barnett.
The governor's chief policy advisor, Carlo Branch, reacted to the former governor's interview, stating, quote, I stopped listening to Eddie Calvo interviews in 2018. And again, that was Carlo Branch. You may have noticed there have been fewer press conferences with the governor since the controversial muting of the media. No press conference so far this week and only 2 held last week. We asked Adelup Policy Director Carlo Branch to explain. Branch texted KUAM, quote, press conferences will still occur regularly, but like any other disaster, there is a shift in operational tempo from crisis response to recovery. Our focus right now is delivering economic aid as quickly as possible and ensuring that PCOR 2 proceeds safely. To do that, we published new detailed guidances and several frequently asked question sheets about federal and local programs. We asked Branch how regularly press conferences will be held. He texted, quote, "As regularly as possible, but I should have a prospective schedule this morning." United Airlines announced today that updated flight schedules for Guam, Saipan, Palau, and Micronesia from May through July 5th. United will be operating an estimated 85% fewer flights during this time compared to last year. United also provided updates for the following routes: Tokyo, Narita. 2 of the 3 daily flights from Guam have been suspended until further notice. Nagoya and Osaka suspended until further notice. Fukuoka suspended until October 24th, and Manila is suspended until further notice. With current COVID-19 travel restrictions in place, flight schedules are subject to change without advance notice. Customers are also encouraged to check united.com for the latest flight schedule and to find out what United is doing to keep customer and employees safe and what measures they are doing in flight. You can head on over to our website. One of the administration's top doctors is telling Congress there could be more deaths if the country is open too soon. White House's coronavirus task force members are testifying before the U.S. Senate today about the government's response to the pandemic, but they're doing so remotely after being exposed to a White House staffer who tested positive for COVID-19. Natalie Brand has more details from Capitol Hill.
Senator Lamar Alexander called the Senate Health Committee hearing to order from his home in Tennessee. The Trump administration's top doctors testifying remotely.
My concern is that we will start to see little spikes that might turn into outbreaks.
Dr. Anthony Fauci warned senators about the risks of reopening the country too fast and says the government needs to be able to quickly respond to new outbreaks.
With good identification, isolation, contact tracing will determine whether you can continue to go forward as you try to reopen America.
Health experts say they are focused on increasing testing capabilities to allow states to safely reopen.
Rapid, extensive, and widely available timely testing is essential for reopening America.
President Trump suggested some are moving too slowly.
There just seems to be no effort on certain blue states to get back into gear. And the people aren't going to stand for it. They want to get back. They're not going to stand for it. They want our country open. I want our country open too.
President Trump is meeting with congressional Republicans this afternoon to discuss how to proceed on another economic rescue package.
We are talking about that. We're negotiating with the Democrats. We'll see what happens.
Senate Majority Leader Mitch McConnell has said he doesn't see a need to act immediately on another spending bill.
We don't need to wait around. Need more help. We know they do.
The House could consider new legislation as early as Friday. Natalie Brand, CBS News, Capitol Hill.
Democrats say state and local governments could need up to $1 trillion to help stabilize their economies and keep first responders employed. In your Banking 671 report, First Hawaiian Bank announces it is donating $150,000 to 4 nonprofit organizations working to meet the unprecedented community need for assistance in Guam and CNMI. With schools closed and many people out of work, more individuals and families with children are needing to seek assistance for the first time during the pandemic. To help support these communities, First Hawaiian Bank will donate $50,000 to the Salvation Army Guam Food Bag Program, $50,000 to Total Guam Foundation Care Package Program, $25,000 to Empty Vessel Ministry Foundation Saipan Emergency Food Bank, and $25,000 to Carrot Out Social Services Saipan Emergency Food Program. And finally, with stimulus checks being mailed out, residents are able to cash them at various banks, even if they're not a member. They are Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. And that is your Banking 671 tip from Bank of Guam and Coast 360. And finally, the Radio Television Digital News Association, RTDNA, announced the 2020 Regional Murrow Award winners, and KUAM received the award for excellence in social media for our region, competing with news stations in California, Hawaii, and Nevada. A record number of more than 5,000 entries. These regional winners represent the best in local broadcast news. The Radio Television Digital News Association is the world's largest professional organization devoted exclusively to broadcast and digital journalism. It was founded as a grassroots organization in 1946. Its mission is to promote and protect responsible journalism. Again, KUAM receiving the 2020 Regional Murrow Award for Excellence in Social Media for our region, competing with stations in California, Hawaii, and Nevada. Congratulations.
Wow, thank you. Thank you guys so much. Of course, we wouldn't be able to do it without you out there in our social media audience. 6:39. Let's keep it going with the news and check in with the CNMI, where Tomas Maglotnia is standing by.
Was standing by.
Okay, so we'll actually take a little break, and then we'll get Tomas back on here at Containing COVID at 6:39. Again, good morning, Guam.
Full price will help.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together,
Chris, here's the latest on what's making news in the CNMI. As the number of cases increases in the Commonwealth, NMI Governor Ralph Torres unveiling the nearly complete CNMI alternate care site with a tour for the legislature and media yesterday at Kanoa Resort. Governor Torres took questions throughout the tour, sharing how he hopes the site is never used. Take a listen to part of the live Q&A with the governor and the media.
Shed some light on the breakdown for the cost of it. We're mentioning taxpayers' money. Do you know how much? 70% right now. How much are we spending? And when we're at 100%, ready to fully make it operational, how much are we going to?
I'm not sure the total number, but I'm sure it's in the millions. Obviously, again, just demanding the hours worked from here, demanding all the employees. HBR had to cease all other projects to bring the manpower here. So we acknowledge that. We acknowledge all the equipment, supplies are flown in from California, from different parts of the world. So it's going to be costly, but when you're talking about health, price is not an option. We don't deter making the right decision because we're short of funding. and we're going to make that again. We're going to make those tough decisions because the last thing I want is making a sound decision because we're short of funding. We don't have all the funding in the world, but we're maximizing those funding to use it here. And we have different facilities here, the hospital, the MCAT. We want to remodel and add lab. So we're going to be seeing a lot of remodeling of the hospital and extend.
Helios Engineering Group are the lead designers, with their engineers creating the state-of-the-art facilities ranging from triage to pharmacy storage. The site, he says, is 70% complete. CNMI Press Secretary Kevin Bautista provided the media after the tour with a letter from CNMI Governor Torres inviting the entire CNMI legislature to the tour. However, only one representative showed up. That's Representative Sheila Babauta, who attended. The CNMI Governor's COVID Task Force also announced that the Department of Finance on Saipan released 27,000 stimulus checks totaling about $42.7 million. The task force also says that the stimulus portal will reopen for direct deposit after they had to shut it down due to high traffic online. We're also aware that the CNMI Governor will appear on KKMP radio on Saipan this morning at 8 a.m. and is allowing media to participate in a sort of press conference format. The release from the radio station here on Saipan says that they're going to be hosting these briefings every Monday, Wednesday, and Friday, and are inviting their media partners to participate to ask questions. We're unclear of the logistics at this time, or if this is ran officially by the Torres administration. The invitation came from the local radio station. And in other news, today the House Special Committee on Federal Assistance and Disaster-Related Funding will be meeting in committee today at the CNMI legislature at 10 a.m. The governor's authorized representative will be there answering questions. Representatives are expected to dig into the funding coming in and where it's exactly going. And to wrap up here, we wanted to provide the latest numbers from the CNMI as of May 12. The number of confirmed cases at total are currently at 19. The number of persons released from quarantine in total is 362. The number of deaths remains at 2. The cumulative number of recovered cases is 12. And we have an updated number here with the cumulative number of people tested through community testing initiative at the Saipan Airport. That number is nearing 3,000. It's now 2,873. We also spoke with Governor Torres yesterday in that live Q&A, saying that he's expected to release his economic recovery plan soon, which he says will be tied to the number of people who undergo community-based testing. Bring Chris, that's the latest here in the NMI.
Okay, thank you, Tomas. We're gonna chat with you in just a minute, but we wanted to get Dr. Tom Shea onto the show here because I know you probably got to deliver a baby in a few minutes. So, good morning, Dr. Shea.
Hi, Doc.
Good morning. Good morning. Never know. Yeah.
People just won't stop
making.
making. It's going pretty good, but we wanted to just ask you first off the bat, what are your thoughts on this issue of the nurses and the frontliners getting the short end of the COVID differential pay stick?
Well, I was watching your show and reading about the former Governor Calvo, what he said, and I think he's absolutely right. It doesn't. If it's in the book that you're supposed to pay the frontliner double, then you should. To change that is kind of shortchanging the frontliners. If you're saying that, hey, they're important at the hospitals, especially, maybe you want to segregate that. Maybe the hospitals need to be double, and then you try to segregate it out. But I think the notion that, hey, we don't have enough money to fund that, I don't know. COVID-19 has given $117 million. I think that should be really allocated under healthcare. GMH only got in a portion of that, only $3.5 million. That's very small compared to $117 million. I don't know who got the bigger chunk of the allocation, but I think they need to revisit that and take a look. Because in the community side, we have the Health and Human Services. If you go on the website of Health and Human Services, if you're taking care of COVID-19 patients, you bill them directly, even if they're uninsured. If they're insured, you bill the insurance. So it's very simple to do, actually, and it dates way back since the end of, I think, in February it started already. So there's funding there. They just have to find it and appropriate in the right areas.
No, there's definitely funding. I saw there's breakdowns that indicated how the Trump administration, what kind of aid and grants that they provided to Guam. I don't have it in front of me, but it was a lot of money.
Yeah, and then if you're looking at the reopening of Guam, the two areas I think you really need to focus on is building capacity. And that's what the COVID-19 funding goes to. It's not the community clinics. It goes to hospital capacity. You have to focus on this COVID-19 and make a priority to dedicate the funding to the hospitals, to GMH, and if GRMC is helping out, they dedicate to GRMC. Even though they're private, you gotta focus on helping the two hospitals, because that's where, if you're gonna need help at, it's gonna be at the hospitalization side. The private clinic side, we have the PPP, the payment protection, like all the other rest of the small businesses, they can apply for that. And again, like I said, if you care for the COVID-19, you can also tap into the HHS funding, and that's very obvious, and that's pretty easy to do, actually.
Now, I understand that you wrote a letter on behalf of the Guam Medical Association.
Yeah, I did. In fact, I was chatting with Frank Campillo, and it's obvious that COBRA, I don't know if the community understands what COBRA is. For example, if you get laid off from your job, it's federal law that you have to provide COBRA coverage for your employees that get laid off or furloughed. But the payment has to come from the employee. So if you get laid off, obviously you're going to have a hard time trying to pay for the COBRA. But what's nice about a COBRA is that you pay the same rate as what your employer was paying for you when you were employed by the employer. So what the letter is saying is that because of this pandemic, they need to include Guam into the COBRA coverage for up to 6 to 9 months, I believe. And I think Marcos San Nicolas and Congressman Sablan, actually, office called me yesterday. We had a long chat, and I think they're going to work it in. And I think Michael San Nicolas is going to work it into the House discussions, and I think Guam will be. I'm hoping that they include Guam into the bill that includes the COBRA coverage for our island.
Right.
But I think it's good. You know what the percentage is positive from Guam is? Do you guys know?
0? No.
Overall. It's pretty close to 0. We tested. Let me just give you an example.
I don't know, but we're thinking about starting a squares thing in the office, and I think 0 positives is the winning bet every day.
Well, I'm talking about overall percentage, right?
Yeah.
I'm not talking about just last week or two. I'm talking about overall. We tested nearly, I think, 4,000. Maybe we've gone past 4,000 by now. But the amount of positive we tested, I think, was 156. Let's just say 160, for example.
Okay.
Or even 170. I don't know. The amount of positive we have is less than 0.05%. That, I think, might be the lowest in the entire country, if I'm wrong. But that's very low. I mean, the nationally is higher, much higher than that. So I think Guam is doing good, and I think I want to thank the people, thank the media for helping us, taking out these PSA ads to stay home, and I think they listened. And you got to remember, Guam is flat. We're not New York City, Korea, or even Japan, where they have towering, condos that fits 5,000 residents in one condo. But I think we're doing well, and I think we're okay to start opening up. What I'm working on right now, and I've been busy this past week, is that I've recently diagnosed 3 patients with cancer, and they're very young. So I'm trying to get them off island with treatment because we don't have a gynecologic oncologist on Guam. We have one going to rotate through later on this year. But it's very difficult because we have to work on this, and I think the governor also needs to work on this as well, is that it's time to look at those patients that need to go off island for care, medical care, I mean. Cancer is not something you take lightly. And once you diagnose it, you want to try to get that patient out and treat it as soon as possible because we don't have the specialists here on Guam. So that's what I'm working on this past week.
What else you want to? Anything else you want to add in here, Doc? Because we haven't talked to you in a little bit.
Yeah.
I know you've been busy.
Get out and exercise. It's okay. I'm not breathing hard because I'm walking up a hill. It's so hard to wear a mask when you exercise. So I don't think you need to wear a mask when you're exercising, as long as, like right now, I'm standing in the middle of a park and there's nobody here. So I think it's okay.
Well, I saw you got a haircut.
I did. Oh my God. I did. In fact, I went to the barbershop. I called her and I said, hey, listen. And I go into a hole in the wall barbershop. I don't go to a salon, right? So I call her and say, hey, listen, I'm going to wait outside. You call me in when you're ready, okay? And then she snuck her head out and said, I'm ready. So I snuck in there, got my 10-minute buzz cut, and I got out of there. So I feel so good. Oh, my God, 2 months of hair in my head. I'm like, God. And then, I guess I should be thankful that I still have hair. A lot of my doctor friends are going bald, and here I am complaining about too much hair. So
it's a good problem to have, Doc.
It's a good problem to have,
Yeah.
and I'm glad that I got a haircut. Gave her a big tip.
Nice.
She was very thankful, so I think that was good. But one thing I have to say though, I think the message out there is, people are getting money, the stimulus check, which is very good. But one thing I have to emphasize, when I was growing up in Taiwan, is that my grandmother always say, hey, rainy day, you got to save that money. So if you get these checks, I know some of the bankers saying, hey, get out and spend. Well, hold on. I think you should save that, okay? Use it for essential items. Don't go out and just buy anything you want and just spend. I know the economy need a fuel injection, but you got to think about your families and think of the times when you don't have money and you don't have the $100 to go buy your kids food and cereal and things like that. So save the money when you get the stimulus check. Use it for only essential items. Don't listen to the banks and just say, go out and spend. That's not how you do it. Save the money for a rainy day. And there's going to be more rainy days to come. I can guarantee you that.
Hey, Doc, I wanted to get your thoughts because you talked about exercising. And what do you think about the gyms? Now, we haven't really got a lot of clear info on what the deal is. The gyms aren't allowed to open right now.
I think the gym is okay to open. And the gym is going to have to adapt to the new gym sort of atmosphere. You can't have gym crowded anymore. If you got a capacity of 100, maybe start off with maybe 20, 25. And then work it out from there. But each area is going to be designated. If you're going in as a couple, as a family, then you're entitled to your area. But rope it off. Be creative with it. And once that session is done, make sure you wipe it off with sanitizers. And I think it's okay because, man, I don't know. I think I'm gaining weight, so I need to get back to the gym as well. But we do what we can. But you got to stay healthy because 6 months from now, if the population gets other diseases, that's going to be worse for us. So we have to ensure that our gyms get up to par, and I think they can do it. They just have to watch themselves, And theaters, theaters is a tough one, but if you can have a capacity of 200 in the theater, hey, if you want to open up for 20 people and block off one person per, every 10 seats, that might be still okay. If you really think about it, right? Is there a limit as far as airline goes right now? Sure, I think they're trying to block off some seats, but still yet, when they say you can't have more than 10 people congregating, when you're in an airplane, you got more than 10 people no matter what. Yeah. So it's tough. But the more important thing is I think the governor's office needs to work on right now is how do we take care of the medical emergencies, cancer patients, those patients who need to get off island, and we don't have those treatments on Guam. That has to be emphasized. And I've been working on that this past week. That's why I think Philippine Airlines is going to start flying soon. And I think they have a strict quarantine that came out and released today. You may want to look at that. When you arrive at Philippine Airport, they test you right away. And you go into a quarantine facility until that test is positive or negative. If you're positive, you stay in the quarantine. If you're negative, I think they'll let you out. But if you're going to the Philippines for medical care, for example, cancer treatment, things like that, heart disease, if you go there, I'm working it out right now that if I have an accepting facility, accepting physician, they'll take you straight from the airport directly to the hospital, and you stay there. Even in Hawaii, it's the same way. I've gotten an exemption from Hawaii, the state, that I'm sending 2 patients with cancer, and they will exempt them. They will exempt them from quarantine. They'll go to their hotel. They go to the doctor. They go to the hospital. They can go and get food. You need that as essential. So things are being worked out, but I think from the governor's office side, I hope they've been looking at that because I've been working at that for the last week and a half because we have patients who need to get off.
There's also one thing that you've mentioned in the past, and it was about, testing at the airport. And then we hear I think it was over the weekend, that there was a passenger that was able to get to Saipan, and then he tested positive for COVID-19 at the airport.
That's a good way to reduce our COVID positives is let them go to Saipan. Is that the strategy? I was wondering.
Oh, Chris,
was there an executive order?
And I guess you don't count them to the total here, but you count them over there in Saipan.
In the old days, back in Hawaii, they sent people to one of the islands there for leprosy and stuff, right? We don't do that anymore. Yeah. But you're thinking out of the box. But today's, I don't think that's going to pass. But I think testing at the airport is important. That's what I've been focused on. I say, are you going to keep quarantining all these people that are coming off? I mean, you're never going to be able to open the island.
Yeah.
You never will. And the Guam Business Bureau and the entire industry for the 2 months side, you might as well just, cancel the entire area and turn it into all condos. Make all the hotels into condos and make their hotels into affordable housing. That would be a good one for Guam. If they're not going to open the airport and start letting tourists in, continue to quarantine people, test at the airport. As they come down, test them. And if they're positive, yeah, sure, you got to quarantine them. But I think the residents, when they come back, I don't think they should be quarantining at the hotel.
Right, and the Governor's Physicians Advisory Group, that was one of the things that was supposed to be discussed last night, was they were going to recommend that residents returning from anywhere in the mainland U.S. or in the CNMI, instead of mandatory quarantine, that they go on home quarantine. I mean,
I've been recommending that for weeks, because you can just make sure that they have a cell phone and you call in, just like jury duty. You got to call in once a day, let them know, hey, what's going on, and let your presence felt. But I think the residents on Guam are, right now, they're flying back. I think they're well educated. They're very careful. That's, at least the patients that I've talked to are those who are flying back. But I think you cannot continue to quarantine for that long. Even in Hawaii has a quarantine procedure that's in place, but their tourism industry is dead. And they're going to be heading to a recession if they don't do something about it. And they know that. The stimulus money that's coming in, the trillions of dollars, God, I'm really concerned and worried about that, because where are we getting all this money all of a sudden, Something's got to give. Either we're going to be in huge debt to the foreign countries like China, for example.
Yep.
I'm telling you, China is going to own the world. They probably do already. But the United States is going to owe China in all kinds of stuff, in trade and everything, because the more money we print out for the community, which is a good thing, but I think it's writing checks that we can't really cash in the long run.
Right.
So
I think there's an old saying, writing a check with your mouth that your tail can't cash. Doug, I wanted to ask you, because I know that you've been critical of, fairly critical of the administration. So we had, obviously, I know you said you saw the interview with former Governor Eddie yesterday. But what did you make of the response from Adeloop's policy director?
I didn't hear the.
Let me tell you the response. His response when asked by media to give a response to the Governor Calvo interview, quote, "I stopped listening to Eddie Calvo interviews in 2018." End quote.
Oh, that's kind of insulting, in my opinion. I think all the governors, regardless of their history, even Governor Gutierrez, I think if I was governor right now, I'd call all of them in. The last 5 governors, I say, hey, listen, I need your help.
Exactly.
Tell me how to help this entire island, because 5 governors is better than one single governor, in my opinion, because there's history and they've experienced disasters. Bring them all in, sit on one table, and let's.
God, what a sight
We're
that would be.
We're in this together.
Can you imagine if the sight of that, and they open a press conference and like, ladies and gentlemen, the governor of Guam, and then you see the governor with the other governors, like, hallelujah.
Hey, you got 5 governors sitting at one table. Oh my God. Hey,
6 feet apart.
Criticizing by then.
We said this, I don't know, last month. How many weeks ago?
You said it last year.
Jeez.
Yeah, but I don't know. Maybe Eddie Calvo is going to run again. Maybe he'll be the first elected third-term governor. I think he qualifies now since he sat out a term. So you never know. He's making himself vocal. So the Republican side don't really have a candidate, I think, up.
Right.
So
yeah.
Maybe they're starting to talk and chat, and I don't know what former Governor Calvo is doing right now, but I'm sure he's enjoying his life. But I don't think he can stand aside.
Farming, yeah.
I don't think he can stand aside and watch his island, in the state that it is. But I think we're going to get better. But I think asking for help is not an insult. I think we have to put all our egos aside.
Yeah.
And people can say, I criticize, but really think about it. My criticism is constructive criticism. It's how to make the island better. It's not to criticize somebody to put them down or anything like that. It's to make things better. I don't have any financial interest in this entire game.
But I think that response, Doc, I stopped listening to Eddie Calvo interviews in 2018. It kind of really shows that the pettiness of the administration, and it also shows that maybe that's why they don't invite Republicans to anything. And it is what it is, to quote a phrase. It's party politics. But I would just say to Carlo, maybe you should listen to this interview and take some notes, because The guy was governor for 8 years.
Yeah, that's not chump change. 8 years. I think.
I wonder what he does though when he hears Governor Eddie. Does he like just close his ears? No.
I don't know.
I stopped listening to that.
Mute. That's what they
mute.
Well,
Yeah.
Yeah, I think the governor is reaching out. I think he's reaching out. So it's okay. Go in. You can't shake his hand right now, but give him a mask and bring him into the room. Bring Governor Gutierrez and.
How do you find time to be that petty in the middle of this pandemic? I mean, it's crazy.
Yeah, I think it's good. Bring all the governors together and then, put all the differences in politics aside and then focus on what needs to be done. I think that's what we call togetherness. If you can put all the politics aside, bring everybody together in one room. Yeah. But again, transparency again is very important. And the AG's got a headache right now.
Oh man. Okay, let me tell you guys. I tried to get the Attorney General on the show this morning, obviously because Governor Calvo called him out. People want to hear from the guy, and the response I got. Let me just pop this up for you, Doc. And I feel like it's very reasonable for us to request to have the AG call in. I mean, it's kind of normal.
Sure.
But the response I got was, can we get AG to call in tomorrow at 8:30 to discuss procurement, contracts, double pay, etc.? And then the AG spokesperson, Carlina Chafaris, writes, we can schedule something after we issue our opinion and request from the senator. And then I put, so not tomorrow. She said, we're still working on our response. We have not issued an opinion yet. We have yet to review a contract as to form and legality on any COVID contracts.
Any MOUs?
Right. It's tough to discuss things that we haven't seen completed or reviewed. So.
Yeah, you wanted me to talk about the procurement process. Well, that's important because you want a timeline. When was that procurement process, the date of the first discussion of that offer or any kind of MOU was discussed? That's very important. Timeline of events are very important. When it started, transparency. But I kind of wanted to hear him on the criminal side. I'm more concerned about that because 2-3 weeks ago they're letting people go. They can't prosecute. They're going to put them in jail. What I want to hear from the Attorney General's office is two things. One, I got no response to my letter. Remember the letter I wrote about the counterfeit and fake products that we should order? I haven't got that response. I think it's been 2-3 weeks.
Wow.
If you have a list of that, please let the public know so we don't order. You cannot fault the public from ordering products that we don't know that it's counterfeit. So if the government has already said we're going to confiscate counterfeit, then you must have a list somewhere. Show the list to us, publish it in the media so that we all know, protect the consumers. That's what I want to hear, number one. Number two, from the AG's office, how are we handling the criminal cases? Because we need to focus on that. How are we doing that? If the medical side, if our healthcare providers can help with that side, then certainly tap into us. We will do our best to help. But those are the two things that I particularly wanted to hear. But yours is important too on the procurement side, though, Chris.
I mean, I think the point is we just want to hear from the guy.
Well, yeah, I mean that'll be good too, right?
That's all I'm saying. You're a big boy. You're elected Attorney General. I mean, why is it such a big deal for you to call a talk show? I don't understand.
Yeah, and I think BJ Cruz did call in one time, right?
Yeah, he did. Yeah.
Yeah, I know. I text the guy too. I said, hey.
I mean, I gotta say, no, Democrat, Republican, whatever. Objectively speaking, I totally agree with Governor Calvo's call out. I mean, it was classic, and he only said what a lot of people are thinking.
Yeah.
We stand here and we report on this stuff, and it's silence from the AG, it's silence from the public auditor. It's crazy.
And you know what's good about Governor Calvo right now is that he's out in the community. So he's actually feeling the private sector side. So that is a valuable experience for him because now he's feeling the pandemic from the private sector side. So I think that is a very valuable lesson that we can learn from him. So hopefully he speaks more. If we can't hear from other people, then we can listen to him. But, if you ask me which senators are Democrat, which senators are Republican, Chris, I have no idea. I really don't. Seriously. I have to really look at, okay, this is a Republican senator, that's a Democratic senator. I really don't focus on that when it comes to voting. When I vote for somebody, I look at the track history. I look at the bills that passed, and I look at if there's any conflict of interest. Those are the things that I look at when I vote. So, it's election season for senators, so we'll have to see what happens, Joe.
Oh, yeah.
There was speaking of the legislature, there was a public hearing that was held, I believe it was yesterday, regarding health insurance. and
How are
choice.
they holding the public? Is it with Zoom that we can zoom in?
Yeah,
and
it's
testify?
through Zoom, virtual public hearings now.
Okay. Well, I missed that one.
I'll send you the link.
Yeah, okay. I missed that one. And then I guess they'll call you when they see you on the link or something, I guess, right?
Yeah, it's pretty incredible because you see all these people up on the screen.
Now, the only I don't what did they discuss yesterday? I think it was a bill.
It was
regarding...
a choice of insurance.
Oh yeah, okay, yeah. That I do support. I think giving patients choice in insurance is a good thing, and I think Aetna, I think they're coming around, but it's still sometimes it's difficult to contact them because they're really off island. Netcare is local; they're doing a good job with their plan. So, I think expanding health insurance, and I don't know, I think the bill says we're going to expand it to only 2 choices, correct? If that's the same bill. Yeah. My recommendation is, why limit it to 2? Why not open it to all the insurances so they can compete and let the people choose? If one plan is more expensive than the other, then if you're if you're working for GovGuam, if you don't want an expensive plan, then you choose a cheaper plan, So, work it out and see. But I don't know if going with one is saving them much more money. But certainly, I think it's something that.
Yeah, I mean, the more the merrier, Doc. Totally agree. I mean, it should be Aetna, Netcare, Select Care. There should be an option in there to Surahanu.
Sure. I mean, even for doctors, I think giving choices to see whoever doctors you want. Right, yeah. I think that's good too. You don't want to limit. You don't. The bill that say, hey, I want you only to go see Dr. Shea. And, I said, whoa, that's not good. I will protest against that because I don't want anybody to come and see me, and only me. I want the bill to say you can go see anybody else you want. It's your choice. Right. And I think if you give the patient the choice, the autonomy for the patient, the health care will be much better because they will say, hey, I chose you, and this is the relationship that we have, and we're going to work together, and we're going to improve my health. And if, I can pick you up cancer early and we'll get you treated. There's a relationship. There's a doctor and patient relationship that's so strong that, it's not by the books. That relationship is built upon trust. So you got to have that trust. But choice is good.
All right, Doc. Thank you so much.
Thanks,
Doc.
Doc.
It was supposed to be 15 minutes. I think it took 20 minutes.
I get carried away.
We always like talking with you.
Okay, we'll talk later, okay?
All right,
Doc.
take care.
All right, sure, bye-bye.
There you go, Dr. Tom Shea. 7:12. We'll take a little break and come back with Tomas Maglotnia with CNMI. A little chit chat.
I thought we talked to him.
We did, but he's got some stuff he wants to share that he's working on for today. 7:12. Good morning, Guam.
Ambrose Inc. bringing you trust.
Keeping you informed. KUAM News brings you Banking 671. Brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Jermaine Alert, who's the, what is he again?
Developmental Disabilities Council.
Yeah, it's bad when I can't remember.
Developmental
Guam Developmental Disabilities Council Executive
Director?
Honcho. Anyway,
he works at the quarantine.
He works at the quarantine, and I just thought it was funny, and I think this is Facebook, it's going around on WhatsApp. I'm glad that our local government has a mandatory quarantine policy for all travelers terminating in Guam. And unless one of the frontline public health officials make a determination otherwise, a 14-day quarantine means a 14-day quarantine for everyone. No comments, please. I will delete all comments. I said please.
He posted that?
Yeah, if you're making the 15% COVID differential pay and you're getting catered to with free meals, of course you want the quarantine to keep going. I can't wait till my FOIA comes in. Good morning, 717. Of course, we're going to be talking about this throughout the morning. We've got a new FOIA to share with you guys, so keep on listening at 718. Let's go back to the CNMI, and I wanted to get Tomas back on to kind of talk about this. You were finally able to get CNMI Gov Ralph Torres.
Yes, and so actually there's some new controversy developing this morning with that visit because, as I mentioned, Kevin Bautista, the press secretary, gave us the letter to the president and speaker of the legislature inviting inviting all the members of the legislature, but minority members and some leadership members are posting on Facebook that that's incorrect. They never got an invitation. I spoke with the one representative, a minority member, Sheila Babata, who showed up, and she said she was just, crashing the party because she didn't get that invitation either, but heard of it through the media. And so that's one thing, but talking about access with the media, with Governor Torres, so we were actually, because it was just the media there, we're able to ride on one of the CODA Commonwealth Office of Transit Authority buses that is sanitized from right down the street of Canoa Resort, going back to the alternate care site at Canoa Resort. And during that bus ride, I got a chance to sit next to him, the governor, and ask him a few questions about the increasing cases we're getting, whether or not his view on the airport, flights resuming, and other things like that. And then he was there for the 1-hour tour that we were given, and he also took questions live in the end. I asked him about costs. We played that little clip there saying that you can't put a price on health. He said it's in the millions, wasn't really giving us any certain number. But like I said, KKMP Radio seems to be organizing its own press conference and inviting the media. So it's not something officially run of the CNMI governor's office, is my understanding. But
that's interesting.
Yeah, and I was chatting, and they said, "Oh, it's like the KUM radio show." Like the radio show. This isn't a press conference.
Yeah.
And so I think that it is very interesting because it's not a formal invitation from the governor's office for the press conference. It's an invitation from a media partner to join their own
interview. To join their interview. Basically.
Yeah, their own interviews, and that's at 8. I didn't receive. I got the link, but and I'll be joining that. I'm not sure what the format is, so it's a bit confusing right now, but it's slated for every Monday, Wednesday, and Friday, I believe, or at least 3 times a week.
Over this radio show?
The local radio show, yeah, and they said that in the invitation, the radio show said that the governor's been doing his daily briefings there, which is a little news to me. I didn't know that was the daily briefings, but apparently they've been doing that since March, the daily briefings on that show.
Tomas, how was it to finally get Governor Ralph Torres? Your voice seemed a little bit shaky in the interview. I know this is something you've been wanting to do. Just walk us back to...
savage move, by the way, to get right in front of him, right next to him on the bus.
I mean, you did what you had to do.
Well, when I see an open seat, I just got to sit in it. And my mind was racing. When we thought that we were having that one-on-one interview last week, Adriana, Brie, and I, we got together and we drafted questions. So I had like 20 questions already that was drafted and sourced, and so at that point, I was just trying to, obviously we were there for the alternate care site, and so I wanted to focus on that and the new cases and the airlines. And we have a story tonight on 2 small businesses that are struggling here in the CNMI. But
Tomas, I'm gonna put up this pic that the governor posted on his Facebook page. If you guys want to check this out, where is it? Right there. What a interesting bit of eye contact there you were making with the governor of the CNMI, Tomas.
Yeah, and when I sat next to him, he said, "Oh, you're here? We would have done an interview earlier if I knew you were here." And to me that was a little surprising. But when I first got on island, I did message the press secretary saying I'm here on behalf of KUAM, and let's get as much as we can out. And so we're hoping, the governor said, to coordinate with him, with the press secretary for an interview tomorrow.
Nice. Tomas, I got to ask, who looked away first, you or the CNMI Gov?
Oh, my goodness. Chris, I don't know. I was just, you can see kind of my Jason-inspired gear there.
Yeah. It kind of looks like you're like, Luta versus Saipan, let's go about right now.
No, that wasn't in my head at all.
Right now, Luta versus Saipan.
What was in my head was just trying to, think of which 20 questions to ask, because we've had so many questions.
I hate that when you're like, God, which question should I ask?
Yeah, and so we have a lot more questions. We'll see if we can ask more of them at 8. Again, the logistics for the 8 a.m. briefing, I guess is what they're calling it, is unclear. The invitation I got wasn't necessarily directly from the radio show, so I don't know. We'll see how that goes. Obviously, sharing that on tomorrow's show. But we got lots of new information that we'll cut up, and I think in total we spoke to him for about 15 minutes of just him speaking and answering questions.
Where did the link come from? Was it from the governor's office?
The link was sent to me by the press secretary. So
okay, so then he would be able to control whether or not you would be able to ask a question.
Again, the format's unclear. I don't know if they're monitoring it. This is not something done out, on the governor's platform. It's done on the local radio show. So we'll see how that goes. That's in about 40 minutes.
But if it's over Zoom, then they have control over the audio, what's going over. And whether or not,
and again, this is their show, so I would assume they have all the control. So, yeah.
And that's not a press conference. That's just a show. It's like somebody else's show.
Yeah, it's a bit confusing. I heard about it meeting the other reporters from the other outlets here, saying that they were invited on to participate. So,
okay. Well, hopefully you get in some questions.
Yeah, I mean, we definitely appreciate the hard work you're doing over there in the CNMI, Tomas.
Yes.
Yeah, and and just gonna just tease a story for tonight. We spoke to Philip Canuto, who's a flower shop owner, and he had he caters and sets up events for weddings. He had 6 weddings canceled this season, and then we spoke with Rob Trevilla, who runs Tribe Mariana's Clothing, and all of his stuff has moved online. So we really wanted to bring these local business stories to the news, and it was just I was speaking with some of the business owners. They said what business looked like for them in March was basically zero, nothing. So I think it was interesting to kind of hear of all the good news happening, and then going out into the streets and the community and listening to them. And they're on the brink of collapse basically, and so it's a hard story, but definitely want to share their perspective as local businesses trying to survive in the CNMI. You know, the owner of that shop has been here for 28 years working in that business. So,
Tomas, you know, with the Guam resident who traveled to CNMI, you know, positive, has that changed maybe how stringent they're looking at flights coming in? Is this something?
Yeah, so I did ask that again. You know, they reiterated that the FAA really is the only one with authority, but they're going to continue with their quarantine protocol, and that also includes testing passengers upon arrival. You know, we've been trying to ask about whether or not what the involvement with Guam DPHHS looks like. I know you guys asked Dr. Manglotnya yesterday, and we still don't have a clear response about what contact tracing looks like in Guam, because that positive case is from there. But you know, we did outline what it looks like here, and all the passengers on board were tested, and then United, of course, came out with that statement saying they removed the aircraft for deep cabin sanitization. So hopefully we get an answer on what contact tracing looks like for Guam residents, too, with that positive case that arrived here.
Well, we were able to talk to Dr. Manglotnya from Public Health yesterday, and she said that process has already begun.
But she didn't really have any details.
She didn't have any details on it,
Yeah.
All right, Tomas, thank you so much for checking in, and congrats on getting the CNMI Gov. And, you know, it's like after the first time, I think it's going to be easy from here on out.
Yes, well, he did say that he's willing to do a one-on-one interview tomorrow, so hopefully we get that scheduled.
Nice, all right. Let me know if you need, how many questions you got?
No, he's got a lot.
He's got
he
a
does.
I have like a whole 10 pages ready.
Oh, Lord.
Yeah.
Okay, Tomas, thank you.
Thank you.
Thank you.
Talk to you later.
All right, Tomas Manglotnya, of course, in the CNMI. He's actually on Saipan. Yes, he's been on Saipan.
Yes. So, CNMI Bureau Chief.
Yeah. He's the only guy. Yeah. Hey, let's say good morning to Jason Solis. Good morning, Jay. Part of the Edward R. Murrow Award winning social media.
Well, it is truly a team event, and you know, by no means, you know, are we in the business to win awards. But you know, I actually took the call a couple days ago from the gentleman who called up and just said, like, look, I know you guys are busy. He actually took the time to figure out the time difference, which basically, if you've ever worked with any mainland vendors, no one ever does. People call us, you know, 3, 4 in the morning, and they're like, oh, you know, can we interest you in, you know, a new camera or something like that. This dude actually took the time to do the time conversion, called me. I think you were getting a story ready. The boss was on the phone with like something like that. So I went to the two of you like twice, and I was like, okay, guys, some big announcements, and both of you just like shooed me off. So I went, typed in Microsoft Word, we won the award, printed it out big, held it up. And I just told the guy, I was like, you know, that really means like a lot, because we really needed that. And you know, like, it's not just us, it's all of our colleagues, you know, in journalism, and have been doing like so much work and everything like that. But I mean, it really is a team effort here, and it really is a testament to our community, because we could put out, you know, the most amazing interactive exhibits the world has ever seen. It means nothing if people don't consume them, share them, talk about them, and everything like that. So I mean, this really is a community award. So thank you guys out there in our community. I just wanted to say, part of our team and everything, can we go ahead and anoint recently newly minted college grad Tomas as, you know, like, hardest working man in show business? Because we've even got some behind the scenes pictures that we didn't show on there. This guy has his own like camera rig that he brings everywhere. He's setting up his own audio, his own video stuff, and everything. I mean, he is a self-contained unit.
He told me yesterday that because he was out in the field for that tour of that facility on Saipan, that you know, with the deadline, he had to write a story up really quick, and he was like, I voiced it under a towel in my car. So he made like a little towel tent,
like a sound booth,
like a little sound booth. And he was voicing his package, reading his package out, and I wonder how that looked to people in Saipan looking in, like, what the hell's going on in there?
And that's why he can say, hey, this is why KUM has the best hustle in the game, because, you know, whatever it takes.
We bring towels.
Yeah,
we bring towels.
Do what you gotta do.
Have you guys ever had like a really weird moment? Mine was, I want to say maybe 8 years ago.
It was on tangent time.
It was on the Liberation Day parade, and I was supposed to interview at the time Congresswoman Madeline Bardallo, right? And it was one of those times when, you know, beautiful day, Liberation Parade, but she's up on the grandstand, so I was standing on the side waiting for her. Of course, it rains like hell, so we get this massive torrential downpour for like 5 minutes. So here I am, you know, huddling underneath a stage, holding electrical equipment, waiting for the rain to stop so I can interview the Congresswoman. And I was like, you know, that's why we got into this business, for moments like that. It's fun. But anyway, there are a lot of really good conversations. going on. You guys are actually following along with what we're doing. Dr. Shea had a great interview. People are talking about Tomas and the access he's gotten. But there's a lot of really good conversations going on. People still talking about the stimulus checks right now, wanting to know when. People even asking each other, did you get yours? I'm waiting for mine. People being very, very supportive. And a lot of people actually took Dr. Shea's suggestions to heart and saying, yeah, it would be nice to actually go out and kind of like treat yourself, because after 2 months of lockdown, do something. But, you might want to save your money too, because the future is very uncertain at this point. So people really appreciated that. And hopefully you guys share other thoughts. Let us know in the comments what you guys plan to do once you get that stimulus payment. Right. Because that would be interesting. People getting very, very creative.
I know we got copies of a copy of one of the checks. And we're still trying to figure out what it means, what it stands for, and
a certain acronym.
Yeah,
we have Administration Director Ed Byrne on the line. So
okay.
I reached out to Daphne about the stimulus checks, and we'll go ahead and bring Mr. Byrne on. Good morning, Ed.
Good morning, Chris.
Good morning.
First of all, we had saw on the stimulus checks. What is that RIS economic stimulus? What's the RIS stand for?
It doesn't really stand for anything. It was just a misprint. It's there, and in order to get the checks out, we just left it because it would have taken another 3 weeks to get the checks.
Oh. What was it supposed to state?
It wasn't supposed to be there at all. So.
Oh, okay.
I thought it was IRS, and then maybe it was RIS.
Well, it might be, but that wouldn't have been a good choice. So, because it's not the IRS. I mean, the IRS is providing the money, but it's coming through us. So.
Well, I got to thank you. That's some good decision making there. I mean, people would have just had a
fit. I mean, if you we got to reprint these. No, yeah. So.
No, that obviously would have been a bad choice, and we've already, because you're going to ask me this, so I'm going to tell you because I got the statistics. The first 20,000 batch is already in the mail. And I think if you walk past the post office here in Tamuning, you could see people, there's a line of cars, so I assume people were going to their post office boxes to have a look. The second 20,000 arrived here sometime yesterday afternoon, and we expect to get them in the mail today.
Right, that's some good news, Mr. Byrne. I guess, so I sent you the stuff that we wanted to kind of talk about. What can you tell us about this issue?
Can I just ask, that was for the federal stimulus, right? Or both?
That's the money that, the federal stimulus that DRT processes, and we cut the checks and mail them out.
What about the
Programment Salapi Ajudini.
We on Friday and this is a completely new program that we stood up within a week. We got some information from Public Health, who has the information on the people that are in receipt of public assistance. We actually got out about 500 checks on Friday, which I think it's already released. So there was about 365,000. And over the weekend, we've cut about another 3,000 checks. So we would hope to be able to release them. And because this is a stand-up program and we're getting the information incrementally, it's not going to happen all at once.
Right.
We expect to get it all done. At that rate, we should be done by the middle of next week, assuming we don't get anything else.
Mm-hmm. Right. Well, so what's the total amount in the local disaster aid program that's been distributed so far?
So far, the first batch, that 500, was 365,000. The second batch that we've cut but not yet mailed is 1.7 plus. That's about 2.5 million.
All right, so good time to be checking your mail, guys.
Yes, I'm sure U.S. Post Office likes this too, because it keeps them busy.
Yeah, I was actually at Tamuning Post Office yesterday shooting some video, and there was a really long line, and this was in the morning, and I was like, anybody get their stimulus? No, but I think that it probably hit the post offices maybe a little bit before lunch, because we started seeing pictures going around of people taking pictures of their checks.
Yes, it's hard to drive out of here because of that line.
Right. Ed, so I guess can we just start with, because I've been trying to get you on this electronic fund transfer that we had sent a FOIA to, and this was electronic fund transfer made to pay the hotels being used as quarantine. Can you just tell us a little bit about that process? And then, I sent you some questions about the certification of funds paperwork, who approved the EFT, and how was it recorded in the AS400?
Well, everything's recorded in the AS400, so... when a payment is made, it's recorded in the AS400.
Right.
Going back to the actual, an invoice was sent to me, and I believe it came from the previous chief of staff, saying, can we pay this invoice because we have some people already in that hotel in a quarantine status. So we did that, and I think it was like at the end of last week, I got an instruction from the governor to pay these invoices that were acquired under this emergency purchase.
Which invoices?
Invoices, I haven't got them all yet. Whatever invoices that come from hotels or the people that service the hotels, I'm instructed to pay them.
Is this in through email or a verbal phone call that you're getting instructions?
There is a formal instruction I have.
When you say, is that in writing or is that over the phone?
Yes.
It is in the writing.
No,
Okay.
It is in writing, yes.
Okay. So is that kind of a normal procedure? The governor sends you an email and tells you to pay somebody, and then you pay them?
Of course not. But none of this is normal. I think it was well established last week that this was an emergency purchase, and the procurement rules. And I think, even before I spoke to you last week, I think John Brown was talking about this. The normal rules don't apply in these circumstances.
What about this issue of the timesheets for the Adeloop staffers? So we got the timesheets, we got the statement from Adeloop. What can you tell us about that? And then if the cabinet on the staffers up there, to include the governor's legal counsel, aren't going to get paid for these hours, again, maybe could you explain why we're documenting them?
Well, I suspect if they didn't document them, you'd be asking me, why didn't you document them? We asked everybody to fill out timesheets if they were reporting to work as essential workers, so that we would know who the departments were nominating as essential workers. I did one, and if you look on my timesheet, though, if you look at it, I took out any monetary amount, so it just shows the hours and $0. And I guess it would have been better had we received the timesheets in that form, but nevertheless, these timesheets it was quite clear in the executive order that governor staffers are not being paid differential pay, except in special circumstances that you referred to before, where people are servicing the hotels, or the people in the hotels.
I wanted to follow up on what you mentioned earlier regarding you got the formal notice from the governor to pay out services. So is she the only one who can tell you that? Because you said Tony Vivalta also did. Is she the only one? And who else has?
Nobody else has.
So just Tony Vivalta and the governor have ordered you to...
The governor is the governor, right?
Well, Tony Vivalta was Tony Vivalta. He's not the governor. But you said he called you up or he wrote something. Did he call you or did he write something and tell you to pay?
No, I think he called me.
Can you recall the call, Ed?
No. But let me just say this, and this is important, right? That if the instruction I have got from the governor was to pay whatever invoices were presented, and that means invoices that were presented and paid, and invoices that are yet to be paid. And the last invoice I got, I think, was emailed on Sunday night.
Okay. How many invoices have you paid?
At this moment, I couldn't tell you exactly, but I think we paid 2 hotels 50%, We paid, I think, 7 laundry bills, and that's it so far.
Were the two, the Wyndham and the Days Inn? Is that the one that we reported on?
Yeah.
Okay. How come there haven't been any payments made to other hotels? Like Santa Fe, I think Perlis Court was also one of the facilities that they were using.
Right, because I've just got the invoices.
I see.
And we can only pay invoices when we get them, right? The instruction was to pay an invoice, not to just make a payment.
Right. So where's Office of Civil Defense and Guam Homeland Security in all of this? Are they kind of out of the loop? And because it seems like they just get a direct line to you. And again, that's just part of this unprecedented pandemic procurement?
Yes, purchase, not procurement. Remember, yes. I mean, in these circumstances, every department has been trying. The executive order suspended some rules and regulations. I'm not a legal expert, so I don't know which, but I know that we're having to do things in a different way, all of us, right, because of this pandemic. And we honestly want to make sure that everybody understands that we're trying to do this in the fairest and the most reasonable way. And in this circumstance, I don't think anybody was harmed. Right? Every hotel had the opportunity to offer their facilities. Some chose to, and some didn't.
What about Pacific Star invoices? You haven't got any from Pacific Star?
I have now, yes.
You have now. I see.
Yes, and they're in the process of being paid. And like I say, I've got a few, I think 2 more laundry invoices, and I have some food invoices.
Right. The food invoices, can we discuss that a little bit? Because we had just got a FOIA response. The food invoices you're going to pay, is this going to be for passengers who are quarantined in the facilities, or is it for the staff that work the facilities, or is it for both?
I don't know, because I've just got them and haven't studied them. I know they were revised. So we got actually on Friday, and then we got a revised version, I think, on Monday. I don't think it was yesterday. I'm pretty sure it was Monday. And I imagine that that was a response to removing some food supplies that were not relevant to the hotel. I think it does include food for those people that are staffing the hotels, but I don't think it's every meal. I think it's just, whenever those staff are there, we paid for the meals for the people that are helping the people in quarantine.
So these don't have to have contracts, right? Just as long as you got the invoice, you don't have any other you don't have to have any other paper trail justifying anything. Like no agreements are in place. It's okay just as long as the governor says, go pay this. And here's the invoice.
This was an emergency procurement.
Right. Well, I'm just curious because Charles Estevez said, "Where's the contract?" when it came to Mr. Hai Hyun sending over information about these food contracts, and Estevez is like, "Where's the contract?"
And then what happens after that is we get a memorandum that the governor addressed to you and Lester Carlson, which we're going to kind of go into, and this is for the meal services. But Ed, I want to go back to what you said. You said that the invoice was modified, and that there was there a removal of the governor's office from the meal service? Because when we spoke with Policy Director Carlo Branch, the email from Hai Hyun shows that 20, and I'm not sure if that's 20 lunches, 20 breakfasts, 20 dinners, are being provided to the office of the governor, and then Carlo had said, oh no, we're paying for that out of private funds, but I didn't see anything in the FOIA that indicated that. So has this invoice and the services been amended to exclude the governor's office?
Well, it excluded some meals, so you and I could both conclude that it included those meals, but it didn't say that they were specifically included for any one thing, and nor would you expect them to.
Well, I would expect transparency, but
I mean, I'm just going off the email we got from Hai, and it had a breakdown of what hotel, and then there was one there, Office of the Governors. Well,
the transparency, I mean, we don't construct the invoices, Sabrina. They come from They come from the third party. So
right. No, I understand that you don't get to see what's there. You're just doing what you're told to do, and it is to pay these invoices with or without a contract, because the governor has special powers under Title 10 to just not follow procurement rules. They can be thrown to the side.
That wasn't the answer to the question you just asked. Right? The providing company is responsible for how they construct their invoices, and they would present me telling them, and perhaps you telling them, how to construct those invoices.
Right, but it just is strange when you have the Charles Estevez on an email chain saying, hey, yeah, I can facilitate the payment, but I need a contract or I need an invoice. And then the next step is the governor comes out with a memorandum writing a letter to you guys. And it's basically, the gist of this letter that I got was that it's a cover your butt. She's making this is why I need this to get paid, and I need to get paid yesterday. And so what we're looking at here is almost $80,000 in catering provided by Capital Kitchen.
Yes, that's true. But can I just remind you, one of the other things that John Brown said in that interview was that apart from saying that this was an emergency purchase under extraordinary conditions, nobody has protested. Right? So can you conclude from that nobody has been harmed? I already mentioned that each of these hotels got the opportunity to tell. I think it was done through JHRA, was allowed to determine whether they wanted to be used as a quarantine facility or not. I can only assume that everyone feels maybe not satisfied, but they're okay with the process, because I haven't heard that there's been a
yeah, it's not over
protest.
Yet, though.
Have you?
I haven't, but I don't know if people knew that they could bid or what. I don't know the process said, but I'm pretty sure that it might not be accurate to say. I guess it's true. You can say there hasn't been a protest yet.
There hasn't been a protest yet. That is absolutely true.
What about
what I know.
Right. What about the differential pay for essential workers for the past 9 weeks? When are they going to get all that? Since some decided to return the checks, this was just bad all around. $23 checks. We're hearing from some $130. Can we kind of go into this? So why aren't they getting paid what they're owed?
Did they tell you how much they should have been paid? I've seen, and let me take a step back here. Right. DOA wants to pay people what's owed to people. But DOA relies upon the departments that employ these people, first of all, to tell DOA that they've employed them, and that has been an issue. Again, in this fog that we've got of people being moved around departments and asked to do things that are different from their normal activities, some confusion is, I guess, inevitable, even if we don't like it, and we try to minimize it. But we do rely upon departments to tell us who they employ and to send us timesheets that record the time that they work, because the differential pay can be different on each day. So we have to have a timesheet that records that. We've had I can tell you, we've had a timesheet from one person that worked half an hour in the whole period. And so the people that got this, what they want, I guess they are.
Are you blaming the employees?
I just feel like we just created this COVID-19 response pay plan, and hey, everybody, figure it out.
Let me answer your two questions. One was a question and one was a statement. No, I'm not blaming the employees. Okay. What I want the employees to be clear about is, if they worked 3 hours and they got $160, that doesn't sound out of proportion. If they worked 3 weeks and got $160, then we need to look at it. But we haven't. The timesheets that we got didn't cover that whole 3-week period consistently from each agency. We got the remainder yesterday, and we're paying the remainder today. We really do want to pay people.
So it's just paperwork that's held everything up, and people not filing and submitting the correct documents and timesheets?
What if the governor sent you an email and was like, hey, just take care of this now?
Well, then, but remember what she said was pay the invoices.
Right.
Yeah.
No, but if she sent another one, said pay the differential pay.
Pay the timesheets, then that's exactly what we're doing.
No, pay them whatever.
Well,
She could tell you that though, right? Because Title 10 gives her superpowers.
She could, but she didn't.
But she could.
I think that's what's rubbing people wrong is you got these. I mean, man, we elected a nurse. You got nurses out on the street corner protesting because they're not getting what they're owed, and then you have on the other hand, we can rush through $80,000 worth of meals for political hires. It's just how it looks, Ed, and I'm sure.
Well, I don't think we rushed through anything, right? We paid some. You can put whatever. I guess I won't be able to stop you putting any kind of construct on it that you do wish. But I want to pay nurses who work, and I want to pay them the differential pay for the time that they were exposed to the virus.
Yeah.
And I would like to say that nurses, lab techs. All these people that are contributing to this have done a fantastic job because we've kept down the number of infections on Guam. So let's obviously make sure that everybody understands what a good job they're doing and continue to do.
I think they just would prefer to show them the money.
Right.
Ed, man, I got a comment here because you had talked about a protest. So one of my friends is a small business owner, and he put in here. Did I hear that correctly? Capital Kitchen got $80,000 for providing meals to the quarantine areas and the governor's office. Was there a bid put in? I could have bid for this and stayed open instead of closing down for 6 weeks. That's not fair. I know that's not a formal protest or anything, but
right,
I mean,
it isn't a formal protest, and we haven't paid that yet, as I said earlier. And should your friends,
but you were told to.
Why haven't you paid it?
Should your friend feel that he needs to file a protest, then he's, I guess, more than welcome to do so. Right. But
is the office open to go file a protest?
You would have to do that
online.
Public auditor.
That's the public auditor.
Okay, got it.
But let's go back to where we were at the beginning. This was an emergency purchase, and I'm sure you wouldn't want. It takes a long time. Procurement is not an end in itself, right? Procurement is a way to get people paid for goods and services they supply to the government. In this circumstance, it was determined that we had to quarantine people that were arriving from wherever they were arriving from in order to protect the general population from further infection. That strategy seems to be more than successful, but it required some pretty fast things to be done, and that was why there was an emergency purchase. And your friend, is welcome to follow that up and.
I know. I think I read somewhere about sole source procurement, right?
Mm-hmm.
Yeah. Is that what happened?
That's part of emergency. No, that's not what happened. That's part of emergency procurement. Is you can nominate a sole source where a particular product or service can only come from one particular supplier.
Ed, what about and I send you a FOIA on this, but the directors, the deputy directors, these Adelup staff who are working at the quarantine hotels, have they submitted their requests for the COVID differential pay? And can you tell us how many and how much, if you do know?
I don't know, but yes, some of them, where they were working in those hotels, yes, they have submitted, and you'll find it out in the FOIA. And can I just talk about FOIAs, right?
Yeah.
I got another one from you this morning.
Right.
I think that now makes 3, and I've got 2 more from another source.
Mm.
We will obviously respond.
No, man, Ed, I got to say, you're really good about responding. Yeah.
Right. We've only got a small staff here, and that same staff, if it's a payroll issue, are responsible for paying out these employees. So we'll do what we have to do, but please also, I mean, I would like everybody, and you too, please, to understand that some of the people in DOA have been working pretty hard since the beginning of this, and
but you can't bring in
I'm very grateful for them for the effort they're putting in.
Right. You can't bring in an extra staffer just to handle the FOIAs, the avalanche of FOIAs that you're getting?
Well, they wouldn't know where to look, and that's the problem.
The invoices that you're getting and you're going to be paying out, are they going to be through an electronic transfer, or are they going to be like printed checks?
We prefer to do EFTs because it's much cheaper.
Okay. No, because when we FOIA'd, we FOIA'd for payments, and we didn't get that because there were no checks.
Yeah, so
we had to, now apparently we have to ask specifically for electronic transfers.
Right.
Yeah, we're trying to get paperless. We reduced the number of employees who get paid by check by I think about 2/3, so they get direct deposit now. And we're trying to get all vendors to be paid EFT. That's what the federal government does, and it's so much significantly cheaper.
Ed, would the cabinet staff and the political hires work in the quarantine hotels and facilities? Were there any issues with the timesheets that they've submitted?
I don't think so. I have issues. I have a staff who are supposed to be dealing with this, but not that they've told me.
Aside and maybe you already asked this, aside from the free meals that Adelup is getting, are they also getting any of this differential pay?
No. They're not getting free meals. I don't know if they're getting free meals. As I tried to answer your question, that some things were deducted from those invoices.
Right, yeah.
Okay, but what about the differential pay? Are they getting differential pay?
No, they're not getting differential pay. It was in the executive order that the governor's staff does not get differential pay.
Okay.
Governor's staff and cabinet members who would otherwise have been entitled to the 10%.
And so you said you're not sure if the governor's office is getting meals. According to your read of those invoices, and I know you're a sharp guy and you read, I know you read things before you pay it out. Who is getting the meals?
It didn't say,
Right, so you can't say whether or not they're getting it.
No, I can't. But all I can tell you is what I said, right, in response to your question earlier, that the second invoice had a reduced number on certain days. I do read them. That's how I knew that took place.
Yeah. Well, I think we've had it confirmed from Carlo that the meals are for the staffers who are working at the quarantine. So it's a pretty sweet deal. You got that director, deputy director, Adelup staffer salary. You get 15% on top of that, and then you get catering.
You pulling a shift, Mr. Byrne?
We didn't get it here. We didn't get it here. So.
You're not getting any meals over there, Ed?
No, except in the interest of transparency, the director of Revenue Tax did send over some meals. I don't know if it was a meal. I think it was a pizza to my Treasurer of Guam staff yesterday to make sure that they were fully stuffed before they stuffed the envelope.
Well, Daphne's a great lady. That's it.
Yes, I didn't have any.
Are you getting the COVID differential pay?
No. Okay. No, I think I answered that before too.
Right. Yeah. I'm just checking if it's because it's rapidly evolving.
It hasn't changed.
Yeah.
That hasn't changed. I am not getting it, and I don't expect to get it. And that's just part and parcel of the job.
I know you said you want to pay the nurses, you want to pay the frontliners. You brought up the issues with the timesheets. How are we doing in rectifying this and getting them paid? And is there a timeline?
Well, as I said, the ones I mean the timesheets that were missing or not submitted to us related to the second week or second pay period of the current amount that we're paying will be paid by today. Can I just also add that when we had some people that would have qualified to be paid for the period before, when the executive order first came out, there was work being done that wasn't yet covered by the differential pay. The executive order could not make that retroactive, and the retroactive part got muddled up in the bill that the governor vetoed. And the governor has submitted a separate bill to the legislature to authorize the retrospective pay, which is another 2 or 3 weeks, that predated the authorized amount of the retroactive pay. So there's amounts that are going to be owed to those people for that period, but we can't pay it until the legislature acts.
Right, it can't be. It's not retroactively applied.
Right.
Mm-hmm.
All right, Ed. I just wanted to get you on. I mean, the comments with you when you came on, was that last week, and you told us why you don't think we should pay the double pay. People are still citing that rule that you cited and disagreeing with it. So you still stand where you stand on the double pay issue, right? And Ed, is because we're seeing conflicting messaging. The governor said we just can't afford it, and then you're saying that we don't have to pay it.
Well, I said both.
Right.
In my letter to Senators in Augustine, I think I said both. Fortunately, we're in a world where we can disagree, right? And we disagree about many things, and it's absolutely important that every opinion is heard and weighed. And there are ways of doing this, and you're fulfilling part of it here. So, but we just think that in the circumstance that we are now, and there's calls from the private sector, please help us. We're trying to help the people on public assistance. We got out the war claims checks early through the local program to try and help people. Daphne and her team have been working on the stimulus checks, and Dave, the lead fellow, is working on the unemployment. Everybody's working very hard to get the money out to people, and how you distribute that money must be. It's a difficult decision,
right?
But that was the decision that was made.
We had FEMA on yesterday, and there was one of the guidelines in the FEMA pandemic public assistance policy guide that discussed what types of expenses would be reimbursable by FEMA, and they had we had asked basically, so the DOA rules and regs with the double pay, is that something that would be reimbursable? And in the beginning they said, it kind of seems like it, but definitely the COVID differential pay, which was created in the middle of a pandemic, would not be something they would reimburse. So are we looking at the CARES money for that if FEMA's not going to reimburse it?
Yes, and I don't know whether they made this clear to you, but FEMA rarely reimburses at 100%.
Right, 75. But I'm just saying, so your argument is that we can't pay the double pay because we can't afford it, but what if it was 75% reimbursable by FEMA? That would drop the cost way down, and it would then be something that we could afford?
Well, I think we'd have to look at it, but just by way of comparison, I think this is something that the legislature is interested in. The double pay, an estimate of the double pay would have been about $3 million per pay period, and the COVID pay, the differential is coming out roughly about 800,000-900,000, assuming if we got all the timesheets in. So that was a decision that was made, and I wasn't party to that discussion with FEMA, so beyond that I can't really comment.
Yeah. Well, when we get a response, I'll shoot you a story.
He was just saying that the program assistance program, I think B or something, under FEMA, that as long as there's existing rules and regs and laws in place related to overtime, then it could be eligible for FEMA reimbursement at the 25% clip. And if it was estimated that it would cost $36 million by the administration, that would turn out to be about $9 million. But just something you said about the differential pay, you said it was estimated about $800,000
per pay period.
Per pay period, okay. Yeah, because Crystal Paco San Augustine said that $1.1 million was paid out.
That's right, because it was more than one pay period.
Right, yeah.
It was 1.5 pay periods.
I see.
Well, we appreciate you, talking about this double pay issue, because it kind of seems like the administration is you guys are the only ones who's saying that we don't have to pay it, we can't afford it. Everyone else seems to think that they're owed it.
Well, as I say, they're entitled to their opinion, but DOA is the department responsible for determining what gets paid and what doesn't get paid, and you would be as critical as me if we didn't look at these things closely and just let them go. So that's what we did, and that's the conclusion we've come to. And I believe that Senator St. Augustine asked the Attorney General, and we're both waiting for a response.
But if you got a email and a directive from the governor to pay the double pay, similar to how you were told to pay these invoices, then you would pay it.
If it was couched in the yes, of course.
So all we got to do is we got to convince the governor to send you an email with an invoice.
It wasn't an email, as you know, because you have a copy of it. It was kind of formal memo.
Right, yeah.
With backup arguments and everything like that.
Right.
So,
backup arguments. I think they even had like backup arguments to the backup arguments. Okay, Ed, thank you.
Thanks, Chris.
Is there anything else you wanted to add? We got the top of the hour, but if there's anything else you want to add,
in these circumstances, I understand people are getting, edgy, and I get grumpy too sometimes. But a lot of people in the government are putting in very long hours and some of them are not reimbursed, right? And putting a very great effort into dealing with this pandemic, and generally I think the process is working. So let's not take our focus off that, and let's make sure that we continue to do what we're doing, because I think the results, compared with the rest of the world, I think the results are remarkable. So thank you to everybody that's putting all this effort in.
All right, Mr. Byrne.
Thanks, Mr. Byrne.
Wash your hands.
And thanks to DOA staffers, too.
And hey, let's give a big hand to the staff. They're mailing out the checks.
I'll tell them. They're down there now.
Yeah, okay. I'll see you, Mr. Byrne. Wash your hands. Thank you. 806. Is it just a British accent that...
What?
I don't know. Just coming out of his mouth, it's like, well, if you'd like to file a protest formally, then you're more than entitled to do so. If you don't like the cabinet being catered to, then do something about it. Put it in writing.
I didn't think that the cabinet was being catered.
All right.
I really like Mr. Byrne.
Yeah. So we're going to take a break here. Welcome.
There are things that I don't like.
Yeah. So it's 8:07. We're KUAM FM Guam. Good morning to our KUAM TV 11 audience. We'll take a break, come back with news, and a whole lot more right here on Containing COVID. Good morning.
Join us in saluting those
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Now is not the time for us versus them.
GMH Administrator Lillian.
University of Guam Dean of Nursing Margaret.
There is light at the end of the tunnel.
Help is on the way from a marine medical.
Dus proteger
out in the public where all are more exposed.
585 have tested positive.
Good morning, it's 8:14. Get right into it. We're MGHRA President Mary Rhodes coming up. Also going to try and squeeze in Education Superintendent John Fernandez. It's going to be a tight squeeze. 8:15, the day's COVID-19 headlines from the KUAM News team. Good morning, Sabrina Salas-Matanani.
Half a day, good morning, everyone. The latest from the Joint Information Center released just before 8 o'clock last night. A total of 64 individuals were tested Tuesday. 0 tested positive. However, as we reported on primetime last night, 1 additional case was confirmed by the Guam Regional Medical City. To date, there are 152 confirmed cases of COVID-19 on Guam, 5 deaths, and 124 recoveries. Some cases that were previously released from isolation have returned to active isolation status after retesting positive for COVID-19 through follow-up testing. To date, no additional cases have been linked to people released from isolation. Another 20,000 economic impact payments were processed by the Department of Revenue and Taxation, bringing the total to 40,000 to date, and a total of $75.9 million that will be mailed out this week. Governor spokesperson Crystal Paco San Agustin confirming that over 10,000 checks have hit the post office as of Tuesday. We should note that if you owe child support, your EIP check will be garnished as required by the CARES Act. If you have any questions about EIP, you are urged to call the DRT call center at 635-1840 for 1 or for 2. In the meantime, in the CNMI, the Department of Finance there is announcing that its first distribution of over 27,000 stimulus checks amounting to $42.7 million is being distributed. The CNMI Treasury has printed 22,000 checks to be mailed, with 813 to Rhoda, 715 to Tinian, and a little over 20,000 to Saipan. On the front line, but feeling at the end of the line when it comes to being justly compensated.
Roses for Nurses Week, but things aren't rosy when it comes to compensation.
The nurses are so frustrated that some of them are, I'd say, on the verge of tears.
Guam Federation of Teachers Rep. Robert Koss says the union has signed up nurses from all over Gov Guam to join a lawsuit they will file against the governor for failing to pay frontliners what they deserve.
They received base pay. They got their differential pay yesterday. I saw a couple of those checks, $160. That's the difference between staying home with your family and kids or working 8 weeks, $160.
Apparently, it's not just nurses either. Public Health Medical Director Dr. Jana Manglotnya confirms she didn't get paid. Although she wouldn't provide specifics about her situation, she's heard of the payroll plight of her coworkers.
One of the nurses, was saying that she had worked to midnight at the airport, etc., and what she was given, apparently there was no overtime authorized or paid to this particular nurse, and I don't know how many. I no idea. They said it's all of them, but I'm not sure. Mm-hmm. And she, I think, received $100 for hazardous duty pay after countless hours and frontline work and threatened exposure to her family.
Over the last several days, the Department of Administration has been paying out differential pay under the governor's COVID response pay program, where essential employees would receive an additional 10 to 25% extra pay based on their level of exposure. What they won't get paid is double pay, authorized in DOA's rules and regulations when an emergency is declared. According to Koss, though, double pay isn't the only pay missing in paychecks.
This administration, they only paid a portion of what the rules require. So, where do the public employees fall in the governor's priority?
As of Monday, at least 60 GovGuam frontliners have signed up to join GFT's lawsuit. They will continue to take the names of essential employees willing to join the litigation for another 2 weeks. For more information, call the union at 735-4390. Reporting for Guam's News Network, I'm Sabrina Salas, Matanani.
Several nurses held a demonstration at the ITC intersection late Tuesday afternoon, holding posters and signs demanding they get paid what they deserve. Governor Leon Guerrero, in the meantime, has issued the following statement on pay status for employees responding to COVID-19. Quote, no amount of pay could equal the service, sacrifice, and hard work of our frontliners. That is why we created COVID differential pay in the first place, and why we have always supported a new wage study for teachers and nurses. Though we will reserve comment on a matter which may be litigated, we are confident our administration has acted in accordance with the laws of Guam and the government's personnel rules. In the weeks to come, we hope that the Guam Federation of Teachers and others will work with us to protect lives and livelihoods in both the public and private sectors. He's a graduate of the Governors of Guam School, and he's here to give his 2 cents. Former Governor Eddie Calvo taking the floor on containing COVID.
Former two-term telling containing COVID, he got his 8-year degree from Guam Governor's School. Calvo telling KUAM's multimedia show, while he didn't go to law school, he doesn't need to be a lawyer to see something's not right with the Leon Guerrero Tenorio administration's emergency procurement handled by Governor's legal counsel, Hai Hyun.
I've never heard of verbal agreement, by the way, as a governor, and I've been 20 years in public office as a senator and a governor. I've never heard of a verbal agreement in full government capacity, which it seems to have occurred in this pandemic. And it seems like the paperwork is catching up after the verbal agreement. That's something. I wonder why BJ Cruz is as quiet as he is right now there, because he sure would have been yelling when it was if I was governor.
Calvo calling out Adelup Communications Director Janela Carrera for muting the media, saying elected leaders must answer tough questions. He added that Adelup's messaging during this COVID crisis leaves much to be desired. Calvo also called out the governor for her refusal to pay state of emergency double pay to GovGuam first responders.
I don't know how you go around things when it says in the books that you got to pay double pay, and if you called an emergency and then called some folks to come out to work on that, then, you know, if it says in the Department of Administration rules and regs it's double pay, it's double pay. I don't know how you can make an executive order to countermand it.
Although he gave props to Democrat Senator Therese Terlahi asking Adelup tough questions and made a shout out to the Republican minority, Calvo also called out the legislative supermajority for letting the governor slide on many questionable issues. He also said the public auditor and the attorney general have been as quiet as church mouses when it comes to being independent and holding this administration accountable.
Man, they're both quiet. They're both quiet. Where's the attorney general? Where's the public auditor? Levin, BJ, come on, boys. There and start looking and doing your jobs.
For Guam's News Network, Chris Barnett reports.
The governor's chief policy advisor, Carlo Branch, reacted to former governor's interview, stating, quote, I stopped listening to Eddie Calvo interviews in 2018. Well, you may have noticed there have been fewer press conferences with the governor since the controversial muting of the media. No press conference so far this week, and only 2 held last week. We asked Adelup Policy Director Carlo Branch to explain. Branch texted KUAM, press conferences will still occur regularly, but like any other disaster, there is a shift in operational tempo from crisis response to recovery. Our focus right now is delivering economic aid as quickly as possible and ensuring that P-Core 2 proceeds safely. To do that, we publish new detailed guidances and several frequently asked question sheets about federal and local programs. We asked Branch how regularly press conferences will be held. He texted, quote, as regularly as possible, but I should have a prospective schedule this morning. United Airlines announcing that updated flight schedules for Guam, Saipan, Palau, and Micronesia from May through July 5th. United will be operating an estimated 85% fewer flights during this time compared to last year. United also provided updates for the following routes. Tokyo and Narita, 2 of the 3 daily flights from Guam have been suspended until further notice. Nagoya and Osaka, suspended until further notice. Fukuoka, suspended until October 24th. And Manila is suspended until further notice. With current COVID-19 travel restrictions in place, flight schedules are subject to change without advance notice. Customers are also encouraged to check united.com for the latest flight schedule and to find out what United is doing to keep customer employees safe and what measures they are doing in flight. You can head over to our website. In national news, all but 4 U.S. states have now eased coronavirus restrictions, even as the U.S. death toll from the virus tops 80,000. 2 of the hardest hit states are getting ready to start to reopen, including New York. Michael George has the latest.
People in Palm Beach County, Florida, packed restaurants for the first time in nearly 2 months.
Being able to sit here with my husband and have a beer, it's awesome.
It's part of Florida's Phase 1 reopening plan. The state is one of several where an updated model from the University of Washington projects COVID-related deaths rising faster than expected. But Florida Governor Ron DeSantis dismissed the models.
We need to go based off facts and based off evidence and not go based off conjecture.
In Los Angeles County, excitement is building as beaches are expected to reopen as early as tomorrow with restrictions.
I personally can't wait for Wednesday. I'm ready to get back to swimming.
Louisiana will lift its stay-at-home order at the end of the week.
We meet the threshold criteria established by the White House based on declining COVID-19-like illnesses.
With COVID-19 cases also declining in New York, 3 regions in the state will also begin reopening Friday, starting with construction and manufacturing businesses. But the governor says New York City hasn't met the guidelines yet to reopen. And the mayor says restrictions on gatherings and non-essential businesses will likely continue until June at the earliest.
That will be the first chance we get to start to do something differently, but only if the indicators show us that.
With most New Yorkers staying home, taxi and livery drivers have seen fares plummet. The city has hired about 15,000 of those drivers to deliver meals to low-income residents. But the drivers make only a small fraction of what they earned before the pandemic. Michael George, CBS News, New York.
In your Banking 671 report, with stimulus checks mailed out, residents are able to cash them at various banks, even if you're not a member. They're at Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. Additionally, First Hawaiian Bank announces it's donating $150,000 to 4 nonprofit organizations working to meet the unprecedented community needs for assistance in Guam and in the CNMI. With schools closed and many people out of work, more individuals and families with children are needing to seek assistance for the first time during the pandemic. To help support these communities, First Hawaiian Bank will donate $50,000 to the Salvation Army Guam Food Bank Program, $50,000 to Total Guam Foundation, $25,000 to the Empty Vessel Ministry Foundation Saipan Emergency Food Bank, and $25,000 to Caridot Social Services Saipan Emergency Food Program. And that is your Banking 671 tip from the Bank of Guam and Coast 360. And finally, the Radio Television Digital News Association announces the 2020 Regional Murrow Award winners, and KUAM received the award for excellence in social media for our region, competing with news stations in California, Hawaii, and Nevada. The RTDNA is the world's largest professional organization devoted exclusively to broadcast and digital journalism.
Congratulations, guys, and thank you so much to our audience. Of course, like Jason said, we wouldn't be able to do it and put up this content if it wasn't for you guys. Jay?
Yeah, hi, and thank you once again, everybody. Some really good comments. The conversation continues. People asking a lot about businesses. They're still sharing their opinions on what's open, what's not open, and to what degree. On that note, we've got a new episode because it is midweek. It's hump day, so that means it's time for In Full Zoom. So Nestor's got a brand new episode tonight, and we actually, because it's in Zoom, you can do these. You don't necessarily have to do it live. So we pre-tape these. We talked to 3 outstanding people. We talked to our friend Ryan Mummert from Title Guarantee. So he was talking about, what's going on with real estate speculation. We talked to our friend Joe Roberto. You know Joe, right, Chris? From Island Tinting?
Do I know Joe? Are you kidding?
Senor Joe, really nice guy. And, he was even making jokes. He goes, I'm the elder statesman here. And then we've also got Isaac Duenas from Grab and Grub, which is like one of the big stars in commerce right now. I mean, and he even said they never expected that they were going to do this much business, but he goes, we're doing it out of love, and we realize that even though we're the new kid in town, we've got this massive responsibility to take care of our neighbors and our community. And fantastic interview. So Nestor covered a variety of topics with them, and that's going to go online. It's going to be streaming sometime after this show. So we invite you to watch it. Really good perspective. Some really good big business minds coming up with really creative ideas given the situation right now. They talk about what it's like now with Guam reopening, and they said we want to do this right. We just don't want to jump back in and make it all about the almighty dollar. And you're actually seeing companies that are naturally competitors working together, and they were like, better we do that. We realize we're fighting for the same customers and everything like that, but we don't want to see each other go down. We're all Guamanians at the same time, and we take care. In Afamalig, right? We take care of each other. So
in Afamalig,
yeah. You sound like you're from The Godfather.
I think just the way you said it.
Inafamole.
We'll give it a little bit of the inafamole.
Stop.
Okay. Thanks, Jay.
We go and we make chalaquiles later.
Okay. Zany, Jason Solis. 8:30. Let's get Mary Rhodes from the Guam Hotel Restaurant Association onto the show. Good morning.
Hi, good morning.
Well, thanks for coming on. We wanted to bring you on because there's just so many things that are falling in the GHRA's wheelhouse, but we wanted to start specifically on the hotel quarantine and isolation facility procurement and the process that went down, because I know that you said you have some things to share on that, so go ahead.
Yeah, I know that GHRA has been mentioned several times, and I know that some of the documentation that they kept referring to was GHRA, and so I just want to let the community know that the Guam Hotel Restaurant Association actually serves in the RAC with Homeland Security and Office of Civil Defense during emergencies. We've been in this role for more than 20 years, and I personally have been in this role for 14 of those years. And at any time, any given time during an emergency, I heard the interview with the governor yesterday, Governor Calvo, and I think it's really important to note that, yes, anytime during an emergency when these emergency declarations are put out, all the agencies are working together at the emergency response at the center up in Adelup so that we can, or Ageni Heights, so that we can work together to provide resources and also to collaborate and coordinate services during that time. And so GHRA was tapped by Homeland Security Advisor Tumungan together with, at the time, Chief of Staff Tony Babauta, to put a call out to the membership of who would participate in a quarantine facility. So we did 2 call outs in February and then again in March. And that was the documentation that Hiking was referring to. And so I've provided those copies to everybody so that they are clear in the role that we were playing, is just really a call out to see who's interested in providing those services. That does not mean that it goes outside of the purview of procurement. I think it's still important that that the government entities still follow through whatever that process is, whether it's go through GSA or through the proper protocols in getting those contracts. I have to say, though, in the beginning when we did put out the notification, I did have meetings with Homeland Security Advisor, the Chief of Staff, and Legal Counsel with only 2 of the 4 hotels that are contracted with the government. And that was to make the initial meetings happen. And those all took place at Homeland Security. We also had meetings with every hotel and also our tour agents and also the airport. We had industry stakeholder meetings at Homeland Security when all this started in March. And so we were really performing as a group during that time when we were at Homeland Security when the initial executive orders were taking place. So that was with executive orders 2020-05 as well as 04 for mandatory quarantine and isolation. And I know I conducted at least 2 interviews with you and Bree with regards to these services. And so all of that was handled through a call out to our membership. And those who responded, we provided the list of all those who responded no. So DOA administrator earlier, he had mentioned that, I don't think that the question is there is going to be a protest so much. I mean, if there is a procurement protest, then sure. But during this time of emergency, I know that the governor has those powers under Title 10, and the way it's supposed to work through Homeland Security is that they can actually avail of services and get resources through the different racks. But there are protocols at Homeland Security with regards to how those services are retained.
Sorry, Mary,
and
just
also all the paperwork.
sorry. A RAC is a response activity coordinator, right?
Yes.
Correct. Sorry. Yes. So we're a response activity coordinator. So whenever there's a question or a service needed, or let's say it's even water, right, or meals for 50 people, we always send out those requests. And so those requests are sent out to people, and then we get responses of who wants to participate. There are different people within the different agencies who are in separate racks. And so I'm in the rack that oversees tourism together with the Guam Visitors Bureau. And then I'm also in the rack with the vocational organizations who are nonprofits for mass care. And so that's how this transpired, is in the need for temporary accommodations for mandatory quarantine. Mass care was needed to house travelers, residents, military in the time of an emergency during this mandatory quarantine. So that's why GHRA has actually participated at the request of the government of Guam on 3 areas. One is quarantine for the local government, but we only did the initial call out. We did not participate in the subsequent conversations on contracts, which I thought that they received several contracts already to review, and then throughout the last 7 to 8 weeks. And so I'm not sure if that has gone through the AG's office, but I know that they've gone through several edits. And so I just want to make sure that everybody understands that this has been kind of a fluid process. The second quarantine is, of course, with the U.S. Roosevelt.
Right, Mary, can we just, before you continue, I noticed that the governor's office and then also Director Byrne, they keep throwing out that we worked with GHRA, and I feel like they're saying that because maybe in their mind it adds a certain degree of legitimacy to the whole process. But from what you're saying, you only held their hand on the 2 hotels. Is it Days Inn and Wyndham Garden?
Yeah, Days Inn and Wyndham, correct.
So what about...
we provided them a list of all the other hotels who responded, which the rest of them all said no to quarantine. We did also engage Hotel Santa Fe and another hotel that actually did not agree on rates. And so that's why High is referring to 4 out of 5. They did meet with a 4th one before Pacific Star, and I was part of that process.
Well, you weren't involved with Pacific Star in any way, shape, or form?
Not initially, no. That happened after I started moving on to the Roosevelt. So I think that it's important to note that that process already started, and I gave them feedback on who responded to yes, and then we had some initial meetings to explain the services required. But just to make sure everybody also understands that while we were having these discussions, not just on terms, it was also how the hotels would be utilized. And all of the initial discussions were based on quarantine only for travelers to be staying. They were not intended to be isolation facilities because we already had the skilled nursing facility for ISO and the hospital. And so we wanted to make sure that, those locations were never filled to capacity. And as you know, they continued to transfer them out during a period. And even I know that Dr. Shea has been talking about GMH hasn't been at capacity, and there are no COVID patients there, but also skilled nursing facility. So some of those, we did have some at the skilled nursing facility, but eventually they transferred over to Days Inn, which
Mary,
the original intent of Days Inn was actually for medical staff.
Okay, Mary, so sorry because you're just putting so much out there. Going back to what you had said, so the hotels only agreed to be quarantine facilities for inbound travelers. They never agreed to be medical isolation facilities, correct?
Yes, and I believe that was what transpired, I believe, about 6 weeks ago when I got moved over to the Roosevelt. that they had changed the strategy, and I believe it was primarily because, to plan for the increase, the expected increase of what they felt was going to be the surge for COVID, and they needed to build capacity in order to ease pressure at the skilled nursing facility and our 2 hospitals. And so I think the intent was there to provide and build capacity, but we never got to those levels to contain the virus.
So how did that work, Mary? When you guys made an agreement, say, hey, we're just going to do the quarantine, and then did they go back and change the contract, or was there a negotiation to change the terms?
Was there a designation at the beginning for this quarantine for Days Inn and what was the other hotel? Wyndham Garden.
Yes.
Okay.
Initially, under good faith, when they entered into those terms, they entered it under good faith for the rate, which, by the way, is $75 with $25 for meals a day. So it's a package rate of $100 a day, but all inclusive of meals.
That was all verbal. That was all verbal. Okay. And then, it changed to in writing.
Isolation in writing. I believe they made the contracts change to quarantine/isolation.
They made the contracts change? Can you clarify that, Mary?
I believe that they changed it in the language with the contracts, yes.
And was that with the knowledge or the input from the hotels, or was it they just said, hey, guess what? You're now isolation facilities?
The latter, yes.
So they didn't tell the hotels that we're going to change you guys' ice. That's interesting.
Yeah, I think that's why we need to be careful with the optics, right? That it's coming out like the hotels. We have to remember the hotels are providing an essential service during this time, just like any of the essential workers and the hospital staff and all of that. And there are different sides to every story, but at the same time, I think everybody entered this with the understanding that we would do everything to protect the industry employees to not have any contact. And so even Days Inn Wyndham, public health has been servicing those hotels. And so that model, I think, was working. And even though they made it change to isolation, I think the terms should have changed even with the rate, because there are more services to be provided and other concerns when you deal with isolation. And also whether or not the correct medical staff is there, and also equipment. So
who changed sorry, Mary. Who changed the contracts, and when were the hotels made aware of the changes?
I actually don't know all of that. I've been trying to understand it by talking to the general managers. I know that that was all done in the process of getting their final contract. So they have received a couple of versions. So it's just unfortunate because they've been providing these services throughout. And I just want to make sure everybody understands that they too have also provided, outside of what they do on a daily basis, they've donated, they've given back to the community in many ways, but they also are waiting to be paid on good faith based on the terms originally that was set forth.
When you did the call out and the initial stages of all of this, did Pac Star respond yes? They were interested in being a quarantine facility?
Not initially, no. That was after the fact, because not all the hotels respond at the same time. So at the time I provided the information to the to legal counsel and Homeland Security advisor and chief of staff, it was only, I believe, 10 hotels had responded out of 28. And so we have to make some personal calls because some hotels were going offline completely. And I think Pacific Star came online because they were still open, and they were able to clear out some of the people by just by ending services at that time, and they were going to become available. So some hotels were really considered. And just so you know, every time we looked at a new hotel, we always had Homeland Security, Office of Civil Defense, CDC, as well as Public Health, Guam Fire Department, Guam Police Department, the Chief of Staff, Legal Counsel, all go through and do the site assessment. Was not done with Chief of Staff and Legal, but it was done with all those agencies with the understanding that they would be assessed to serve as a quarantine facility. And we have followed this process not just with the government of Guam facilities, but also with the Roosevelt hotels that have served during this pandemic. So we've been pretty consistent in how we've gone about in identifying the hotels based on the minimum requirements, and then also the assessment of those hotels in order to be turned on as a quarantine facility with the approval of Public Health and CDC and Fire.
Mary, was there ever any discussion with the hotels to allow sleepovers for the highly placed out-of-loop staffers? Was that part of the contract?
We never got into how because I think that's really up to the government of how they're going to provide those services. What we did discuss initially was Guam Army National Guard and public health, because that is exactly how the Roosevelt, what we're doing or what we've done is it's all either Guam Army National Guard, police department, customs. They're all provide the perimeter, and everything inside the hotel is completed by or handled by the military themselves. So they're government employees, and they're all corpsmen, medical staff, as well as security personnel and military branches who are servicing this. So when we first did this, it was with the idea that Public Health and National Guard would be providing these services. And that's how it's remained at Days Inn and Wyndham, I believe, and even Santa Fe.
Mm-hmm. So again, National Guard staffing these isolation/quarantine facilities in the initial.
For security perimeters, yes.
But in terms of like delivering food and towels,
yes.
and
Initially, yes, we asked for Guam Army National Guard and also Public Health employees. And Public Health, they were actually at Days Inn and Wyndham the entire time. They had some other government officials, though, working, and so I'm not in charge of that. I know also I've spoken to Rebecca several times and thanked her for all the services because she worked closely even with Days Inn and Wyndham initially, and so I know that we were following those protocols at those hotels. But
so
I have not been involved.
She knew that initially that there were talks of the National Guard staffing, not just perimeter, but staffing these quarantine facilities.
I don't know about that. I only worked with her after the fact, so I don't know how Public Health and CDC had set it up with Homeland Security and GPD.
But I mean, so at Days Inn and Wyndham Garden, because we got the list from Adeloop, are there Adeloop staffers, directors, deputy directors working at those two facilities?
I don't know.
Okay.
I only participated in the coordination,
right,
and I wouldn't even call them solicitation or procurement. It was really just coordination. I think in all my experiences, even with Homeland Security, there's still a process you go through, and whether that's through Chuck Esteves or Tim Muggan or the rest of Homeland Security. But, we have the former HSA guy there, Chuck Atta. He works with FEMA. They're all at Homeland Security. So I think that the biggest concern here is not so much who the hotels are and how they're getting or how much they're getting paid. It's really of how all of this has transpired, and whether or not the proper protocols were in place.
Well, so were the proper protocols followed?
Bree and I are like, no, I'm gonna.
The same thing with DOA's director, Mr. Burns. I would argue that all contracts should be signed before services are rendered. If they're not, like even in the case of the TR, we're finalizing our contract, but at every instance, I've received authorizations from the federal government to proceed on services on each time. So I still have some form of authorization from a contract officer for every service rendered and all the money spent. So there is still a feedback mechanism to ensure that proper protocols are in place so that there's no question when currently right now I'm reconciling. We have 9 out of hotels who have checked out, and so we're going through the cleaning, sanitization, and decon, and I'm still reconciling, the bill. So based on numbers, because you have to have daily accounting, daily records, not just timesheets and schedules, but even down to when food services were conducted, so you can account, and laundry was provided to make sure that the counts are completed on a daily basis so it matches up with what's going out versus coming in. None of the hotels, have these direct contracts with the vendors. These are all being procured separately, right? Whether it's a laundry vendor unless they cook the food inside the hotel, some of these hotels have procured outside. And so there needs to be some reporting mechanisms in place and accounting for all of these things to be authorized, I would think.
So who would the who would the authorizations come from in this particular instance? Not in Theodore Roosevelt.
On the local side.
Yeah. Is it Esteves? Is it the chief of staff? Is it just the governor saying Wonder Twin Powers activate?
They're all working in concert with each other.
Mm-hmm.
Right?
But there has to be something in black and white? I mean, or just... I'm just trying to figure out, you said that there had to be some authorizations.
Yeah, I would think that through those services that have been identified as a need in the emergency declaration, that they would still have to work it through Homeland Security Office of Civil Defense in order that, so when the FEMA funding takes place for the reimbursement, all of their ducks are in a row for that reimbursement and nothing is questioned.
So Mary, you're confident that all the ducks that you helped arrange with the Days Inn and the Wyndham, you're confident that for those, it's all in a row?
No, I've never seen an official contract. I only saw the initial template.
Okay.
So I'm not part of that process.
Right,
I only helped coordinate the call out and then the initial meetings to get them introduced to the Homeland Security Advisor, to Muggin, and to legal counsel.
Okay, so basically, if I could just paraphrase, what you're saying is, or what we're saying is, hey, Adelup has said GHRA was involved. We worked with GHRA, but you're saying, yeah, we started the conversation, did the call out, and, sat some people down at the table, but other than that.
Well, we came up with the initial terms together with the hotels, and they were supposed to have matched what we proposed also for the Roosevelt, which is based on federal per diem rates. That's not what was finally negotiated. So I was part of those initial conversations, but I did not complete the process with contract negotiations because they needed to directly contract with the hotels.
Is it pretty similar, the terms with the GovGuam hotels and the DoD side, like the cost and all that?
No. The federal contract with the Roosevelt is what we initially proposed with GovGuam, which is federal per diem rates. We do have a hybrid, though, because they are combining all of the services together to be a daily rate. So it is different, and we're hoping to... We have our copy of our definitized contract, and so I actually have a meeting with the GMs today to go over that. But it is... it's handled in this initial manner in how it started, but the terms are quite different in the fact that the rates are different because they are based on federal per diem, which is approved by Congress. And also, so that's how we didn't design the rates. The rates were submitted based on those federal per diem rates. And then also in the fact that we've had to include sanitization and decontamination services, biohazard removal, all of that. From what I understand, the government is paying for 15 days additional decontamination, which is similar, but they're going to handle the decontamination directly. And I know National Guard has done training on decontamination.
Right. Mary, I know that you talked about your experience with the EOC, so and I know you were listening. Just kind of looking at the way that some services outside of the hotels are, because I just want to bend your ear on this. With meals, invoices being sent to administration director, hey, pay this. Is this consistent with, in your experience, how these types of purchases are made during an emergency, with the consideration that later on we want to have them reimbursed by the feds in some way?
Yeah, I think it's still about proper protocols and documentation. So even if this all went through Homeland Security Office of Civil Defense, they're the ones who basically handle those processes during an emergency. I'm not a government employee, so I don't know all the intricate details of procurement and during an emergency. Sure. But in my experience with Homeland Security, there are times when we have to, during an emergency, get food, water, shelter. We have to play all of these scenarios out, and also during an actual emergency, during typhoons or whatever, the Homeland Security advisor can make those calls in the RAC and at the EOC together with the governor. And as Governor Calvo mentioned yesterday, all those meetings took place at Homeland Security, and everything is directed in that manner because you have all agencies present. And trust me, I was at Homeland Security for about 3 weeks at the beginning of all of this.
Right, I remember.
Before the Roosevelt happened. So, you know, there were a lot of meetings that we had with different stakeholders, different public-private partners in order to get these services activated, to get cooperation on how do we transfer people from airport to hotel. So all of that was taking place. And so I don't think that anything really was wrong in that, because that's normally what happens during an emergency declaration.
But so just riddle me this with this meals thing, right? So in tracking the FOIAs, we had the governor's legal counsel say, hey, Charles Estevez, I got all these meals for all these people, and this is how many meals, this is where it's going to go to. The guy's going to be in touch, pay the man. And then so we saw Charles Estevez respond by saying to the vendor, can you provide the contract or the invoice? And then it jumped to the governor sending a memorandum to Lester Carlson and Ed Byrne saying, hey, pay this guy. So it appears that, like what you said, when you involve GHS and OCD, they're used to doing things a certain way, probably more by the book. And then it goes from them asking for the proper documentation to the whole process being moved outside of GHS and OCD. So I guess that means they're not really worried about the federal reimbursement, maybe, in your experience, or?
I'm not sure. I think in any emergency, you always want to make sure everything passes muster. You know, you're ensuring that anything you can try to get reimbursed under FEMA during an emergency declaration should have the proper paperwork and documentation to seek that reimbursement. And
that should kind of be the guiding. I would think that everything we do should be guided by, hey, we should make sure that we get reimbursed for this.
Yeah, I don't have SA or any visibility on the meals. That I only know that they were only contracting for rooms together with meals, and it was a packaged rate.
Right. So this is just the separate meals for the other cabinet and whatnot.
Yeah, everything outside of that, outside of rooms, meals, and laundry for the occupants. Right. Everything we've negotiated, even on the federal side, has always been based on occupants.
Correct.
Not people manning the hotels.
I'm sorry, so yes or no, do you feel that the proper protocols based on all your years of experience with the RAC were followed in the procurement of these quarantine, well, at the time you knew, quarantine facilities, laundry services, meals for Adelup staffers?
Well, to be fair, I wasn't present in any of those meetings or conversations thereafter, so it's unfair for me, other than the paper trail, what can support it. Mm-hmm. I'm not familiar with any of those conversations or meetings after the initial meeting.
Okay, so for the quarantine facilities, were the proper protocols followed?
In the fact that we set those up and did the site assessments, and they started transferring. Of course, everybody has hiccups in the beginning, but I think they made those work. I think that the challenges are that it also changed midway for them to go to an isolation, which I don't know why that was important, especially when we weren't meeting capacity at that point. So I think that's very important, because we have a lot of people who are going home to families, and it's very important that, days in was supposed to be for the medical personnel initially, and I know that they identified that possibly for Santa Fe.
Right.
So
but actually, sorry, Mary, how, were you guys involved at all? Because we've been really tracking this now. I don't know what the deal was with Santa Fe, but it's my understanding that Perlis Court, which is a condominium area or whatever, I can't think of the word.
Yeah,
but they're providing housing for the medical staff. So were you involved with the acquisition of Perlis Court in any way?
No, the last hotel that I participated in was Santa Fe, and that was just to contact the owner, not even coordinate services. So anything after Pacific Star, Perlis Court, I was not involved in.
So
Pacific Star, I have to say, though, the only thing is I do talk to the GM regularly, and Perlis Court is not a member of GHRA, so I don't know where that came from. But on behalf of Pacific Star, they were offered the exact same terms with as Days Inn, Wyndham, and Santa Fe.
So when Days Inn was, because we spoke with somebody who was in quarantine at Days Inn, and he was just told suddenly, and everybody else that was there with him, suddenly they were told, get your stuff, and we're moving you over to Pac Star. There's no reason provided. It was just a sudden move. But at the time that they were there, were you saying that they weren't even at max capacity?
The reason why all of that was really important was, you guys have to remember that time frame and when that happened. That's when Duarte announced the closure of the airport in the Philippines. And so that's why Pacific Star needed to happen quickly. I was asked to look at probably 3 hotels, and just so you know, we also approved several other hotels to serve during, in addition, not just Pacific Star, but Leo Palace, Fiesta, and Hilton did a walkthrough for a site assessment to serve as quarantine facilities during that time. But that was only going to be activated if they were going to exceed the capacity.
And a part of this also is, nobody knew where any of the quarantine facilities were at because nobody wanted to tell the public. So that's why we're trying to catch up on where and what hotels were used. But
I know I personally contributed to that because I didn't want to disclose the names. That was part of the agreement, was, with brand standards and just the association and some of the stigma associated with it. But, this is a worldwide occurrence. Hotels are being used for transient populations and to quarantine travelers all across the world, especially the United States.
Hey, Mary.
So
You said transient. So I'm wondering, the whole homeless shelter plan. Has anyone approached you guys about maybe housing homeless in any of the hotels in your inventory or anything?
A couple of senators reached out to me, as well as actually Troy Torres reached out to me regarding homeless individuals, especially the one that got stuck here on Guam from the Philippines.
Brad, yeah.
Right. So they did reach out to me, but I told them that those decisions are really GovGuam's. I'm not in charge of the hotel quarantine facilities, so I shared that with the government officials.
Okay.
But essentially the hotels, in order to have a contract there, they had to pay for the whole entire hotel. So that was really their decision to make on that. But, like I said, I also helped assess additional hotels to prepare in case we needed to bring more hotels online. And so the hotels we walked through, I never did a walkthrough of Pacific Star, but the hotels we walked through was Hilton, Leo Palace, and Fiesta. And so I did those walkthroughs with CDC, Public Health and Homeland Security, Fire, and Police Departments. But we never activated them because they still had people. And also, Outrigger. Outrigger and Fiesta were the only 2 hotels at the time that had quarantine floors. And so we had additional hotels to serve on quarantine floors only, but that's not under contract with the government of Guam. Those were for travelers or military who paid their quarantine directly, not the government of Guam.
I wanted to go back. You said because of all of your experience with emergencies and disasters here on Guam, Edward Byrne was saying how he received these invoices. He got the instruction, the guidance, the formal notice from the governor to, about her powers or superpowers, and this has to be paid. Is that how it works, that you can just have the governor say, in an emergency situation, I guess this is a different emergency than any other emergency we've ever had. So she has these extraordinary powers, right, to pay this out without contracts.
I'm never involved in that part of the process. All we do at the RAC with GDB or with the volunteer organizations is to get the services, and a lot of those times it's donated services, or to get people to work together, right, during an emergency. But I've never assisted in payments or even getting copies invoices to get paid. That is not in my lane.
Right, yeah.
My lane is to help public-private partnerships in securing things during an emergency, and usually those are donated services.
Right, but for the quarantine facilities, though, like you said, Wyndham and Days Inn, you were part of the initial discussions, right? Was there, and it was all agreed to verbally?
Yes, but also followed up with emails. I believe that they already provided a copy of what a wholesale contract would look like, and so that they see what kind of terms they normally work with. So all of that was provided.
But nothing has to be signed. It's okay as long as it's verbal and there's this email exchange that we're looking at you, we want you, we're going to use you, and then all we have to do is send an invoice over and we can pay it out with nothing in a contract form.
Again, that's not my lane. Whenever we get those services coordinated, it's handed off to Homeland Security.
Right.
And they go through the proper agencies to get all of those services procured.
Yeah.
So GHRA and GBB has never done that, and we go out and get contracts. What we do is we just go out and get people to work together and provide these services, and then how all the protocol, all the contracts and things to support it afterwards is really a matter between the government and those entities.
But would you think that a contract would have to be in place for these companies to, or hotels or whoever, to be paid?
Well, there's two things from what I understand with contracting. One, yes, all services need to have at least a PO, if anything, at least a purchase order or a contract, right? But if not a PO or a contract, what they can do is actually they can pay out for those services based on that PO, because that's like a purchase order. It's a promise to order it, right, to fulfill those services. But as far as the payment, again, I'm not responsible for any of that stuff.
But I think
if you're handling like the PR, right, for the TR, are you going to just send over an invoice? Or are you going to have like documents that say this is what you need to pay for?
In order, so what I've done on the TR side, with every invoice, we have occupancy report on daily counts for ins and outs. So we have a daily accounting that's supported and verified through the contract officer. But more importantly, the contract officer gives me verbal authorizations prior to any services even being authorized to be rendered.
I think what's key here, Mary, is you keep saying that the process should go through Homeland Security and Civil Defense. I think that you've been very consistent in saying that. I think in an emergency
situation, they can bypass GSA. Right. But yes, that's how definitely the Calvo and the Camacho administrations did it. As long as I've been at GHRA, in this administration, it was a little different. Although we were all at Homeland Security, I have to say, though, in defense of this, Homeland Security was involved from the beginning. So
on your end,
yeah. Muggin or Estevez, right? So they were involved. Now, where the break in that process was, I'm not sure.
Okay.
Maybe they didn't concur.
Yeah, they didn't concur. Inside joke, Mary. I'm going to send you all the emails I FOIA, because if you got time for light reading, I'm going to send them over to you.
Oh, yeah. I just need so much more work. Yeah.
No, this is like on the entertainment side.
Well, I have also the other thing I wanted to remind everybody is, these are all very different kinds of responses, and I know it mirrors what's happening in North America and around the world. In our pandemic plan, which I know is old, it's 10 years old, more than 10 years old. It's really the Dededo Sports Complex and the UOG Fieldhouse, which they looked at, even for the hotel to hospital concept, they looked at that. But just the cost in putting those buildings together. So I think using hotels to lodge makes sense, but it's unfortunate how much has come out regarding these accommodations, because really it should have just been a very simple process, and we are acting under, the guise of that this is during an emergency and they had to procure immediately. And the reason why they turned on Pacific Star so quickly was really because the Philippines had announced the closure of that market and no international flights going further. But as you recall, he also recalled that decision 3 days later on Saturday. So the decision to turn on a really big hotel was important in order to meet the need and also to plan for that surge. But I think the big question, it's not so much who's getting it and how the services are performed. It's really on how it happened.
Right.
And that the protocols, and still today, the paperwork is not there. Yeah. And I find it hard to believe that... I know, but I find it hard to believe that even on the AG's office side that they haven't seen a contract, because I know that there have been actually 4 contracts given.
Yeah, and I just asked them again yesterday, and they said, yeah, we still don't have a contract.
Well, maybe they don't have a final contract.
No.
But I know there have been several versions of a contract.
Right. Well, I can read between the lines, Mary, and I think you've, again, consistently said that the real question to ask is, were the proper procedures followed? And I know if you're asking that and saying that's the real question, then I think we're good. Yeah.
But again, under Homeland Security Office of Civil Defense, a lot of it is fluid, and especially with confusion.
They got to be involved, is what you're saying.
Yes, but the confusion in this is it's similar to what the Gov said yesterday. It's been treated like as a public health emergency, and we're missing the other half of this, which is the business aspect of it, right? Is with the economy and with the recovery and all of that. So, and I know we were supposed to get to that question, Chris. So I just want to make sure that everybody understands that this was handled differently, I think, because it was a public health emergency. Not trying to make excuses for the government in how it was handled, but because it is falling under a public health emergency, that maybe they felt just with their authorizations with public health, that was good enough, but they still have to follow through with Homeland Security if they're expecting to get reimbursed by FEMA.
Thank you. Okay, Mary, did you want to touch on the recovery? I mean, reopenings, people talking about tourism. So we put on our industry hat, and the estimates about tourism making a comeback. What are your estimates, and what's your appraisal of the situation?
Yeah, we have a coronavirus task force group within Guam Visitors Bureau, and GHRA is a member of that. And so we've looked at a couple of recovery plans for each of the key source markets, being Korea, Japan, Taiwan, and others. And so we get regular market information, both in market with the actual agents as well as on social media, of how these are tracking. I know that a lot of the countries are getting ready to open up, if not already with Korea, but definitely Japan, I think, is planning for end of the month. But, travelers are still going to be wary, and I don't think it's reasonable to expect really for us to have great summer months, or even I think the earliest we could probably see some real positive numbers is probably October. But so much has to be done between now and October, where we really have to engage with our key source markets, the airlines, the airport, all the business stakeholders to get them ready. GVB and GHRA, we worked together with Guam Chamber last week on a workshop, webinar. And so I gave a lot of recommendations on what businesses need to consider and also implement as they prepare to reopen. And so that's really where we need to be at, is getting those businesses ready, not just in this P-Core, but all the way through P-Core 4, so that we can start receiving our own island residents and making sure everybody is safe and practicing good hygiene and safe protocols. So that's imperative before we can really start promoting ourselves to the other market. But in the meantime, it's extremely important that we start those conversations with those key source markets and get the airlines in a meeting with airport and GVB.
That's right. So we're going to get our GVB director to meet
there's an opening
meeting.
Over at
Oh, wait,
GVB.
we don't have a GVB director. Oh, God.
Hint, hint, Mary, there's an opening.
Yes, I understand.
I'll be your deputy.
there's a lot, you know.
I know better than a disunited.
I think we spoke to Mary more about tourism than we have with the general manager, actually.
We never had Pilar on here.
I think that, yeah, we definitely, I was telling Chris, you guys definitely have to keep this, maybe just change the name Containing COVID to something just more about general industry, because you guys are doing a great job, and I hope that this program stays in place, because I think it's very good for the people. You know, everybody wants timely live information, and not everybody's in the car to listen to radio, so everybody has their phones and can watch online, and streaming media is the way to go. But back to tourism, I think it's very important that all those strategies are reviewed with the agents who are in those countries and start planning of when's the earliest we can open up, as long as we meet the conditions of what the governor has put out, but the businesses are really truly ready. And that's a lot of heavy lifting, whether it's the new GVB president, GHRA's president, or whoever, all the industry stakeholders. The point is we have to start getting together to start talking about this, to get businesses really starting to get back online. Because there's going to be trials and tribulations for a couple of months before people really get good at their protocols, right? For opening their doors. And so we need to reassure the rest of the world that when we say we're ready to start having travelers come in and we're not going to have any reinfections, the reality is we're going to have some. There's going to be a second or third wave, but maybe not large as a wave. I think that it's unrealistic to expect that we won't have more COVID. And just so everybody knows, even though I've been working at the command post and Homeland Security, I told Chris that I took my COVID test last week. So I'm in isolation for 2 weeks now because I actually I tested negative. So even if I've been in contact with people who are turning positive, I think it shows as an example that everybody who worked in these kinds of environments, if they remain negative during the whole process, we can have a healthy, a successful reopening of the market.
Are you at Days Inn or Wyndham?
No.
Mary, we got to run, but it's always great to get you on.
Thanks, Mary.
I feel like we got to do a part 2. So
Anytime.
Maybe next week.
I know I asked you guys to give me a break while I've been managing the Roosevelt, but
yeah, Bree was on me to get you on, so I was like, God, okay.
Thanks, Bree.
Yes, Mary's
so I'm
good.
Now, anytime.
Yeah, thank you, Mary.
Thanks, Mary.
Thank you, guys.
Okay, wash your hands.
Stay safe. Yeah,
Wash your COVID negative hands.
Yes, thank you.
Okay, bye.
Bye.
All right, 9:17. We got to take a break.
She's one of the shining stars of COVID.
Yeah, she doesn't work for the administration.
I know, but she's one of.
Okay, you know, we talked about. I'm just going to jump in here before we go to commercial, right? We talked about, you know, who do you think would be on your Mount Rushmore of the containing COVID like guests? I just want to say, in terms of like length of interview and amount of information, the longest interviews we've had so far was Carlo Branch last week. Number 2 is Rebecca Respicio this week, but number 3, Mary Rhodes. Right. Number 4, Mary Rhodes. Number 5, Mary Rhodes. She gives us great stuff.
What is it Nestor said? Nestor was messaging me and said, yeah, she's like Linda DeNorsi. She could fill a whole hour by herself.
Knows her stuff.
And she's authoritative, you know, when you're getting it, you're getting it from the person.
Okay, we're going to take a break real quick. It's 9:17, K-Wave News containing COVID. Good morning.
You know, these days... Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
lot of voices. Good morning. Hey, thank you guys. Containing COVID. Proudly brought to you by Ambrose Inc., IT&E, Calvo Enterprises, Coast 360, the Bank of Guam. On your award-winning social media network, KUAM News, Facebook. Thank you guys so much.
Okay, real quick. I know we got a big interview coming up, but somebody just put a comment in there. Real quick, let me see. It is from...
You want to hear from...
It is from James. He's saying, can you guys try and get Governor Camacho, former Governor Camacho, on to hear his perspective?
I'd love to get him on.
That's interesting.
Yeah. Okay, we'll try.
His lieutenant governor is working. He's the head of the surgeon cell.
Oh, that's right. Yeah.
Yeah.
Mike Cruz. Also reached out to Governor Carl Gutierrez, who I'm working on it. We've got an initial commitment, and I would just really love to get him on.
Most experienced.
Yeah, definitely. 9:25. Let's go to the phones now, where Fire Chief Dan Stone is standing by. Good morning, Chief.
Good morning, Sabrina and Chris. How you doing?
Good morning.
We're doing pretty good. Just wanted to catch up. I guess first of all, how has the Guam Fire Department's operations expanded with the declaration of PCOR 2? Are you guys now doing things that you weren't doing in PCOR 1?
So actually, the Guam Fire Department, as far as business as usual for us, if there's such a thing anymore, has been, for the most part, in place. The only thing that we're probably going to be expanding to here shortly is our Fire Prevention Bureau going into the permitting center over at the Business Licensing and Permitting Center to start receiving from permit requests to drawings and occupancy permit requests. So that line of business will start coming online here very shortly. Other than that, the Guam Fire Department has never really closed during this whole pandemic, and we're ready, maintaining and holding the line.
Mm-hmm. What about your COVID transport unit? Is that still fully operational? You're going to keep that in place until, I don't know,
Thanks for the question, Serena. Yeah, absolutely. Since standing up the COVID transport units, we've handled about 116 patients with those two units since March 15th. So it's proven very valuable to our organization as far as our operations are concerned, because we were able to reduce the amount of potential exposures of our personnel from the 200 plus that we have down to the 12 firefighters that are assigned that volunteered for this particular duty.
Mm-hmm. How has this whole entire COVID response affected the Guam Fire Department? In terms of, have you seen people that have resigned or quit or anything like that because of?
Yeah, absolutely not, Sabrina. You'll find that the Guam firefighters and all of our personnel in the Guam Fire Department are very committed to this fight against the COVID-19, and we're not any strangers to any kind of crisis, whether it be natural or an auto accident or even a bug that we can't see.
Mm-hmm. What about any of them, if they've been activated, like for the National Guard? Are you experiencing a shortage in staff?
No, so actually we have not, and I really do want to say thank you to the TAG, General Esther Agigi, for that. I think she paid special attention to that possibility of, if she was to be able to call up her guard members, that some of her guard members are also the first liners or front liners as well. And if she calls them up, she takes from our ability to continue the mission and operate. So it's been very good, and she's been very considerate about that.
What about testing? Have you guys have your firefighters been tested? I know that that was supposed to be part of the next expanded level of phase of testing.
So funny you bring that up, because as we speak, we have some of our personnel up at the central public health facility awaiting if they've probably already been tested or had their swabs taken. If they're not done, they're probably almost done doing that. Mm-hmm. And we are scheduling them throughout the week, going into next week in coordination with public health, for those who want to volunteer to take this swab.
Oh, so it's on a volunteer basis?
Yes.
Okay.
Yes.
And how many?
I can't force anybody to take the test.
Right. How many have been tested so far?
So we initially, early on, we had a few of our people, our personnel that were tested with potential exposures that came back negative, both with the patient that they handled as well as the testing that the firefighter underwent. To answer the question about how many have we tested so far, we actually have, I believe, 13 firefighters up there right now. So the effort with public health is to start testing those frontliners from Guam Fire Department, Guam Police Department, and to our medical support, the medical staff as well.
Nice, Chief. While we're on the subject of frontliners, what are your rank and files? What are they saying about this double pay issue? Because I know that you guys have had firefighters in the department for a long time. They've worked other emergencies. They've gotten the double pay. So how are you managing these grumblings that we're hearing about on our end?
Well, I totally appreciate the fact that our firefighters, they raised the question. They pose the same questions that I'm sure all other essential employees have raised as well. And we've tried to answer to the best of our ability. I seek out the guidance from DOA as well, and then we follow the governor's guidance as well. And as we go out and explain that to our personnel, sure, there's going to be those that are that still have the grumblings and aren't quite satisfied with the answer. However, you will find a large percentage of our firefighters understand that right now we're in the fight, and so the focus is going to be focused on winning this fight against the COVID-19.
So, are you satisfied?
Satisfied with what, Sabrina?
Well, you said that the majority of the firefighters are satisfied that we're still, we're in this fight.
They're not getting double. They're getting like 25%.
Correct. So so as far as I'm aware, we've been paying them. We're paying them the 25% differential pay, and that came out this past weekend. However, it was brought to my attention that some of my personnel didn't get all of their pay, and we immediately, once that was brought to my attention, we've addressed it and we're working to resolve that. But other than that, again, our firefighters are committed to this fight and committed to the community and making sure that we provide the best possible service we can provide.
Yeah, and I could, talking to, who doesn't know a bunch of firefighters? What we're hearing on our end is they're committed, like you said, but they're very disappointed, hurt, and angry that they're not seeing the same commitment from the administration. So I know that's got to put you in a tough spot. You came over from the federal side, so I don't know if you guys had the double pay over there. But, again, it's got to be awkward for you, Chief, because 25% is not double pay.
Understood. But, right now we're working with what we can. And, the governor and the lieutenant governor absolutely recognize the fact that that they wanted to recognize the work and the efforts and the commitment by the firefighters and the rest of the government that is on the front lines. And so they came up with the differential pay, and for right now, it's the acknowledgement of their work. And so again, like I've said, for the most part, throughout the rank and file, from what I've been getting back from either firsthand discussions with them and/or feedback from their commanders and their assistant chiefs. Again, they're very committed. Their focus right now is on taking care of the business at hand.
So they don't want the double pay.
That's not what I said.
Chief, that's a tough one, man. Feel for you.
Appreciate it.
Yeah. Anything else, Bree?
Do you feel they should get the double pay? Aside from what
whatever the governor says,
or lieutenant governor says, do you feel that they should get the double pay?
Well, if the rules and regulations permit it, then of course that's what they should be getting. But based on the reviews and the discussions with DOA, and they've done the deep dive into the rules and regulations, and I have to trust that the decisions and the logic that they've used to apply these rules and regulations is in line with what we are able to do as the government.
Was that a yes or a no?
It was, I follow the rules as they're outlined in the Department of Administration Rules and Regulations, as well as my guidance from the administration.
Okay, yeah, that wasn't an answer, but I guess since you're not going to answer that question with a yes or a no, what is your message to the firefighters that are hoping that they'll get their double pay?
Well, we will continue to work with the administration. The governor and lieutenant governor are, they've got a lot of things that they're making decisions on, and this is something that they've been discussing and looking for the guidance and getting all the subject matter experts to chime in and provide their feedback. And based on all of that information, the decision was that the double pay was not something that they were going to be able to pay out. And an acknowledgement of all the efforts that are going on, they came up with the differential pay as that acknowledgement.
I feel like a lot of firefighters are yelling at the radio right now.
That could be, Chris.
If it were up to you, though, Chief, would you pay it? If it was up to you.
If I had that kind of money in my pocket right now, I'd pay everybody.
Okay.
You good? Anything else you want to add, Chief?
No, I just want to say to all the firefighters and all of our frontliners that keep up the great work. It's been amazing, the coordination and the efforts and the commitment that each one of our frontliners have been putting on out there. More directly to the Guam Fire Department. Keep up the great work. Extremely proud of the efforts that are going on, the professionalism, and of course the commitment that they've been their commitment to winning this fight.
Okay,
All
Chief.
right, thanks.
Appreciate
Chief.
it. Wash your hands.
Thanks a lot. You too.
Okay, Chief. Some of the comments here. Chris and Bree, remember he was appointed by the governor.
Yeah, we know.
Glenn writes, GPD and GFD are not going to get their double pay. That's just, you would want your chief to go to bat for the guys. That's what every person who's a soldier in an organization, whether it's KUAM, the Guam Fire Department, the Office of the Governor, well, they're going to bat for their guys hardcore. They're giving them 15% differential pay. They're catering for the cabinet. So they're taking care of them. They're committed to taking care of these directors and these deputy directors and these cabinet members. But the commitment to take care of the nurses, the doctors, the firemen, the policemen, the frontliners who kept us safe and helped us get to where we are today with this reopening, yeah, they're not feeling the commitment so much. They're not getting treated the same as these political hires. We are rolling out the gold carpet. It's not even a red carpet anymore, Sabrina. It's a gold carpet. And I feel for Bree because this is just, whoo boy, it's tough to deal with just a constant barrage of nonsense. It's just nonsense and an avalanche. Even when you get the stuff from the FOIA, you're reading it like, what the hell is this? What is this? I don't want it anymore.
I've been laughing a whole lot today. I can't believe.
But you know what? They're not going to break us. We're already broken. Ay, nako. Yeah. And to put the chief on the line and he won't even say that his guys deserve the double pay, that's crazy. That's the definition of a yes man. And when I said I felt like all the firemen were yelling at the radio, they were. You can't tell me these firemen like, oh yeah, no, we're good with 25%, chief. Just munga, never mind. We'll go give it to the directors and the deputy directors. We're committed in this fight. Go, no, munga, chief. It's all right, yeah. Why don't we get in trouble? Really, if I'm a firefighter or a policeman,
you might want to get those posters ready, get some markers or something, and stand over there with the nurses.
Is that really what he said? He said, sure, there were some grumbling still, but
a majority
of the firefighters are good with it. All right, so if you guys know any firefighters or any frontliners who are good with it, just throw it in the comments or, shoot us a message or whatever. I wanted to... Man. But you know what? Hey, the guy called in,
Yeah.
He knows what's going to happen, so thank you.
Where's the wand?
I'm going to bring my wand tomorrow, okay? I'm going to bring my wand tomorrow. No, we're going to bring it tomorrow. I got this message on my Facebook, and, we talked to DOA, Ed Byrne, about paying the nurses, the doctors. Obviously, we're hounding on this double pay issue. But this message I got calling out the Department of Labor. If there are mandates for the specific compensation for nurses, doctors, and frontliners, and it is not being complied with, why is Department of Labor wage and hour not doing their job? And that clearly there is a violation with the FLSA Title 22 GCA. Oh, they know their stuff here. Yep. It's a labor lawyer right here.
Fair Labor Standards Act.
Right. Technically, DOL should be redressing these employees with this matter, with or without an official complaint having to be filed. In that, again, there's an apparent violation. Could it be perhaps that the main labor law enforcement specialist 3 was politically accommodated when this administration came in, with her not having any experience as an investigator? Anyway, I'll jump along here. I'm really curious why Department of Labor is not doing their job to enforce compensation.
Because the Department of Labor director is working on PUA, and the deputy director of the Department of Labor is working over at the quarantine facility.
Okay, so can you just understand that they're, the unemployment FPUC PUA, yeah, that's legit. But this deputy director, he can't fight for you nurses because he's getting catered meals. I'm sorry, he's one of the cabinet that's very fortunate to be wined and dined. Or at least dined. We don't know if there's any wine. I want to be responsible with my comments. But they're getting dined 3 times a day.
Jason?
Being paid for with your hard-earned, tax-paying dollars.
Okay, I have a question for you. If this has come up, because certainly
we're not answering questions.
Certainly in the 4 hours that we do this show, we cover a heck of a lot of information, but you guys are basically interacting with people all day and all night long, right? Has anybody brought up, because what is the next calendar holiday that comes up? Memorial Day, right? Is the next one on the schedule?
We don't get holidays here. You know that.
No, but I'm saying...
one of my old bosses...
for GovGuam people, have they even brought up that if there is that discrepancy, or if there is a question of if frontliners who are working in technically hazardous situations and they're also working on a GovGuam recognized holiday, is there going to be some discrepancy? Obviously, you're not going to pay somebody quadruple pay, but what is then the pay scale? Because somebody's like, okay, I'm in harm's way and I'm working on a holiday. Under normal situations, both of those cases would be double pay, correct?
I don't know, but I just think you got to pay Governor Calvo said it, a Republican said it. Everyone knows Republicans aren't always the, advocates for labor and all that, but he said, hey, we got to do what we got to do. Yeah. If the rules and regs say you got to pay it, you got to pay it.
I'm waiting to see if there's ever going to be an oversight hearing on all of this.
Yeah, who's the labor chair? Oh, that would be
There's
Senator
still
Regine
Bill
Visco.
332426. It was overridden by the governor. That is for the double pay and the differential pay, the governor's differential pay.
I've been trying to get Vice Speaker Talina Nelson for going on 2 weeks. I put in requests every other day. Sometimes I get a response. Sometimes I don't. I feel like they got her tied up in a closet somewhere. They're like, we got to kidnap the Vice Speaker so they don't override this veto.
And we also are waiting for the Attorney General opinion on the whole double pay issue.
I think he's in the same closet, maybe.
Senator Joe San Augustine wrote a letter asking for an opinion.
Well, Bree, can you imagine if they do have an oversight about all the pay issues? I think the number of people who would jump into that electronically, they would break Zoom.
I don't think there's a Zoom big enough.
Yeah, they'd break Zoom.
Any press conference today? We haven't heard.
Yeah, somebody's no. I want to talk about this press conference thing, too, because I actually canceled a guest just to give us a little time.
Oh, okay.
This press conference issue. So we had asked yesterday, what is up with the press conferences? As you may recall, after the media, you guys got the apology?
Yeah.
I'm going to play this apology again here, my buddy. I just want to take us back to a couple Thursdays ago.
I actually wanted to say to you, Chris, that I think 3 groups of people are owed an apology. First and foremost is the reporters who participated in that press conference. The fact that I gave an instruction which resulted in them being cut off or them feeling like their right under the First Amendment was not respected is completely my fault. I should give better instruction, and I'm responsible for that. The people of Guam deserve an apology, because we can constantly point to examples in our history of people who work for the government and think that they shouldn't be subject to scrutiny. And I never wanted to be one of those people, and that's wrong. And third, I extended my personal apology to the Lieutenant Governor and to the Governor. And the Lieutenant Governor had the strength and moral fortitude to apologize to the people of Guam on the radio this morning the moment he was asked the question. The fact that I had to wait for reporters to ask me the question shows that I'm not as brave and forthright as he is. So those who serve the Governor and Lieutenant Governor have to serve them well, and that day was not one of my better days.
It seems like so long ago. You guys remember that?
Yeah.
When they were, was it pretending maybe? Oh, we're so sorry. God, oh man, we didn't mean to mute you. It was no, it was that person. We never got an apology from Janela. Whatever. I don't really care about getting one. But there were things that were expressed by the administration. There was an executive order about transparency, and they did a couple press conferences where they let the media ask questions, and I think that was it. I was like, oh, we're good now. Okay, shut up. We're good. So I had asked yesterday because we aren't getting the press conferences.
Mm-hmm.
I said, hey, what's the deal with the press conference? Because before, when they would cancel it, they would say, oh, the governor has a series of meetings.
Mm-hmm.
Lieutenant Governor he's in the same closet as Talina Nelson. They're all tied up. They only let him out to call KUAM on Tuesday. So we had asked, can you give us a statement on the press conferences? I mean, Jesus Christ. You guys are a communications outfit. You're supposed to communicate with people. Aren't you supposed to communicate with people? So we asked, can you give us a statement on the status of the press conferences? Is it once a week or just whenever? You guys don't provide a reason we're not having one anymore. Before you would say, oh, Gov has meetings, etc. And so the response we got from Carlo, because I wasn't getting a response from the communications director, press conferences will still occur regularly. But like any other disaster, there's a shift in operational tempo. Ooh. From crisis response to recovery. Our focus right now is delivering economic aid as quickly as possible and ensuring that PCOR 2 proceeds safely. To do that, we published new detailed guidances and several FAQ sheets about federal and local programs. JIC still provides information daily, and DPHSS has a real-time dashboard for case data available to anyone. We said, well, how regularly will these press conferences occur? As regularly as possible. But I should have a prospective schedule in the morning. Well, first of all, they're basically saying here that our focus now is delivering economic aid. But I don't think the governor is out there mailing checks. Do you? I mean, is the lieutenant governor running the printer or what? I mean, come on. You don't have any time, and it's not even about engaging the media. It's about speaking to the people of Guam.
Mm-hmm.
And so you mean to tell me that because you guys put out some frequently asked question sheets, that means that we don't deserve an opportunity to ask the governor any questions beyond that?
You notice the governor even stopped her little Facebook messages, her morning messages.
Yeah, and let's just call it what it really is they just don't want the governor out there asking questions as a nurse about why the administration is shortchanging the nurses. They don't want to have her answer any more questions about the procurement with the legal counsel. They don't want her to answer any more questions about how we're hiring. I mean, you saw how that last press conference was. Thanks to KUAM, you pesky, meddling media. Ah!
That Adriana Cotero.
Oh! Yeah, the last press conference was a disaster. The governor doesn't even know who works for her and when. She doesn't. Bree's like, okay, Chris. No, but I'm just saying, just because you put out some FAQs doesn't mean that we're good out here. There's so many questions. I mean, you hear the show is 4 hours of questions. Really, we have a lieutenant governor who has a pulse. He can put the words out of his mouth. When you ask him things, he answers them.
Good or bad.
Good or bad. Why not get him out on a press conference? It's just about accessibility. And that you guys don't get that, and we gotta it's like pulling teeth. Hey, what's up with the press conference? Hello? Yeah, well, it's frustrating. But it's only frustrating because we got you guys asking us questions that we want to get the answers to, and I'm tired of WhatsApping. I'm so tired of it. This is 2020. We shouldn't be having a WhatsApp a communications director or a policy director. You guys should be out here doing your job, putting information out ahead of things. I'm not going to tell you how to do your job, but somebody should. Somebody should. And then this response from Carlo Branch, when asked by media, his response to our interview with Governor Calvo. What was the response, Bree?
I stopped listening to Governor Eddie Calvo in interviews or whatever in 2018.
Yeah, what kind of, who is checking this guy? I mean, that's really what you want to come out of your governor's office? Oh, Eddie Calvo, what the hell has he got to say? I don't pay attention to him. It's 2018. How does that fly? Like, nobody, who is, you know what I mean? It's just so petty. It's petty. And if I was running it.
And it's unprofessional.
It's very unprofessional. It's petty. This whole thing, muting of the media, where you get this half-ass apology. It's all just a bunch of nonsense. And this catering, the cabinet, we're going to spend $80,000 to feed people who are making $80,000 and up. I'm just telling you, I just said they're not going to break us, but I'm near my point. And it just hurts when we got these frontliners and these nurses and these homeless people. You can't even get the damn time of day. Who's going to bat for this homeless? We got a mayor calling up. Yeah. A mayor sending us pictures saying, hey, Chris, they're not doing anything for the homeless.
And we've been talking about the homeless for over a month. I can't remember. It's been so long. And we're still nowhere.
Nothing. Nope, because it's for the homeless. But Lana, if it's for the directors and the deputy directors, the governor will send an email. The governor will write a memo. The governor will tell Ed Byrne, go pay these guys.
Because I said.
It's like my grandma had this saying, when it's for you guys, it's very, very fast, very pchoom. But when it's for us, it's slow. Oh, I miss my grandma. Okay, we're going to take a little break. We're going to try and end this show on a good note. But yeah, and we're going to go into this FOIA that we got about the meals for the catering to the cabinet. I mean, really, that is just like every time I think there's nothing else that could come out, something comes out. And more things are going to come out because we keep asking for stuff. So thank you guys for the support and for being here with us. We'll take a little break, 9:52. You okay over there? We're going to bring our wands tomorrow.
Okay.
Wands,
maybe some wine.
Yeah. It should have been Wands Day instead of Wednesday, but I left my wand in my other shorts. So it's Containing COVID, the KUAM News Takeover, Guam's favorite. Good morning.
Get all the latest updates on your favorite KUAM TV 8.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with IT&E. Be healthy. Be informed with IT&E. Be healthy. Be informed with IT&E.
If I go, would you come running? Save this lonely soul today. Ooh, yeah, I tried to walk, but my heart keeps
man. We need to get an off camera and mic. Hey, we're doing another Stay Home Live Local Fridays this Friday.
Who do we?
Good morning.
I don't know who's on. You know, Joan Charper, she's been producing that show. She kind of took it over.
Great job, Joan.
Yes.
It's going to be awesome. You know who's going to be on? A lot of awesome local musicians. That's who.
All right.
Good morning, 9:58. Hey, you know, with everything that goes on during containing COVID, thank you guys, by the way. Proudly brought to you by Ambrose Inc., IT&E, Coast 360, Bank of Guam, Calvo Enterprises. It is Containing COVID, our multimedia broadcast extravaganza, KUAM TV 11. Good morning. Also, KUAM.com, the KUAM News app, there's a stream, Docomo, Audio Channel 10, and of course, last but not least, on the award-winning KUAM News social media platforms. Yes, I don't know if you guys heard, we won an Edward R. Murrow Award. Thank you.
Edward R. Murrow Regional Award.
Regional Award for social media.
Excellence in social media.
And thank you guys, because you guys are the most excellent viewers, commenters, likers, sharers. I mean, really, you guys are our soldiers, to quote a phrase. 9:58, so let's end on a good note here. I want to bring J.J. Ambrose of Steel Athletics on, and J.J., we're going to pop the pictures on here, but you had finagled some donations for the Salvation Army. Can you kind of just walk us through how that happened and what inspired you to do it?
Well, I started working with Salvation Army last year. It was 2 Christmases ago, actually. My daughter and I would ring the bells over at Kmart, and then we volunteered again this last Christmas as well. But we did this 5K with them earlier. We were actually on your guys' show promoting it, but when quarantine hit, I had like a good relationship built with them already, so it was really easy. I kind of reached out to them and I asked what they needed, and fortunately, through the years of fighting and opening up the gym, I've met some pretty good contacts with Pepsi Gatorade, so I was able to get them, instead of, usually they give us like a donation to the gym for our athletes, they'll give us some Gatorade, but unfortunately since my gym's opened, we just use the Gatorade towards Salvation Army. So I know the Salvation Army was dropping it off at like GMH and like all the frontliners that are working double time, keeping the island safe. So I mean, they gotta replenish too. So hopefully the Gatorade helped them. And then I reached out to Midpack and I was able to get some cases of Monster donated to the fire department. And then myself and Jeff Mesa actually, they were doing like a food drive at Salvation Army, and we were unloading the trucks and filling up the bags for the people that were going to be picking them up.
What was that like, JJ, to be over there? And, we were over at Salvation Army for Giving Tuesday, but seeing the kind of people coming through there, a lot of people struggling. What was that like for you?
It's very humbling. So many families are out of work right now. With like all the shutdowns, it's very difficult, and it's kind of like a bleak landscape for the people that don't have jobs, and are, we work paycheck to paycheck, most of us. So, I mean, it's been, over a month since most of us have seen a paycheck. So, like I just have, I have my daughter Juliet, my wife, and we have our newborn daughter who was just born the day after we hit quarantine. It's a very kind of a bleak outlook right now. Like, fortunately, we have enough money saved to, I think, get us through these times. But, if it wasn't for our diligence with saving, I don't know. I mean, it's very scary to think of it. I wouldn't be able to feed my daughter, So, like, with organizations like Salvation Army providing for the community, it gives me a little bit of, like, reassurance, I guess, that if it ever came down to that, the Salvation Army and other organizations around the island would be there, to help where they could.
Right on, JJ. We just wanted to bring you on and share your story about what you did to help out there, and let you know that you're a COVID hero, man.
Thanks, man. I think just living on the island, we all have to do our part. We take photos of those sunsets. I mean, for me, those aren't free, and you got to give back.
I also wanted to just thank you, JJ, because when we went into this quarantine also, I reached out to you. You were one of the many people that stepped up and helped us with our PSA campaign to stay home. So thank you from all of us at KUAM.
Oh, my pleasure. Thank you guys for getting that message out there. I really appreciate it.
All right, buddy. So thanks, Jay. Wash your hands.
Definitely.
Take care.
Okay. There you go. We always try and end the show on a good note. And so thank you to all of our COVID heroes out there at 10:02. Bree, anybody you want to shout out before we go?
No, same thing. Shout out to all the frontliners. Hopefully, we don't know what's going to happen. You can call the GFT if you want to join in on their lawsuit to get what you deserve. And just also, I wanted to shout out to just the KUAM team in winning the Regional Edward R. Murrow Award for Excellence in Social Media. It was a lot of hard work, a lot of things that went into it. It was for all the work we did last year. So I'm just really proud of everybody.
Oh, we're proud of you, Bree. And yes, Jay.
Can I do like a shout out real quick?
Yeah.
Because Sabrina, I want to give a shout out. I never got the gentleman's name, Bree, but you and I went to 7 Day Supermarket the other day, and the greeter there, nicest dude in the world. I mean, he must be in his early 30s. So, if you're watching or if you know who it is, please pass this along to him. They scanned everybody with the temperature scanner, and then they sprayed everybody antibacterial spray. Made everybody feel at home. Just said, hey, we're going to take care of you. Please go in and do your shopping. Be responsible, but we'll take care of you. Nice guy. Super cool.
And everybody just be nice to each other. Basically, that's the message, right?
Yep. I just want to shout out to those people who have risked their lives, risked their families by working the front lines of this COVID-19 response. I feel you. I'm sorry you got shortchanged, but we're going to just continue to hammer on this until everybody is paid what they're deserved.
Be safe, everybody.
Hey, yeah, thanks. It's 10:05. Again, to everybody everywhere watching us all the time. We appreciate it so much. For Sabrina Salas Mantonani. Let me get a good song in here, Bree.
Okay.
Any requests?
I always request the same song.
Yeah, she's either like, play Hagu. I'm like, we played Hagu 85 million times. Okay, play Senguaiza Haguan. So I'm
or
gonna play
JD Crutch. I like the
right. I think I'm gonna go with a little IGP. My gang at a net and Geff Pago. So Bree, good job today, and congratulations again on the Murrow Award.
That's everybody. Congratulations to our team.
And congratulations to our people out there. It's 10:05. Hey, thanks for watching Containing COVID. Oh yeah.
See?